Yeah, go on.
Sir, could you pull the microphone down
Mike?
a little bit closer to you?
I clicked on mine. I
Yes,
took
sir.
me to
So I
Melanie
just
Little
managed to-
Stream.
All right, whenever you're ready, Mr. Brennan.
Thank you, Your Honor. Good morning.
Good morning, sir.
Could you please introduce yourself to the jury?
Voice.
So my name is Timothy NUTTAL. I'm 28 years old. I've been a firefighter paramedic for ever since I graduated high school.
Timothy NUTTAL.
I graduated in 2015.
Yeah, he's the paramedic, isn't he?
Mm-hmm.
I took my EMT class and got my certification while I was actually still in high school. From there, I moved on to the BLS transfer side of EMS. There's 911 EMS, and then there's transfer, which is basically back and forth from hospital to hospital. I was brand new and very young, so I started on the transfer side, kind of learning the job. I started primarily in the city of Chelsea, Everett, Malden, Somerville, up there. And then after a little while, I got my feet wet in the 911 side. So I was running BLS 911 in those cities as well. And then I progressed on to become a paramedic. So
Why do you have such an interest in being a first responder at a young age?
I kind of grew up in a first responder household. My father was a firefighter in a local town. So we spent kind of a significant amount of time at the station when he was on shift. It's just kind of how I grew up, kind of learning the ins and outs of public safety. That's just kind of how I came to be interested in the profession, and then I took it from there. So
I want to take us back just a little bit. When you first became interested in training to be a first responder, did you share with us your first training was as an EMT?
yes, sir.
Can you share a little bit with the jury what that entails?
So to become an EMT, like there are two sides of EMS, and then there are two sides of providers. There's EMT basic, and then there's paramedic. To answer your question, sir, to start as an EMT, it's about a 4-month process. You take classes. I believe mine was Tuesday, Thursday, every other Saturday. Learning just anatomy and physiology, basic pharmacology, and kind of how medications interact with the body and different disease processes. From there, you start learning basic interventions, backboarding, C-collars.
As part of your work in learning to be an EMT, you active in the field?
The initial training is, like I said, that's mostly classroom-based, but once you sit your national written tests and you're able to pass all that and pass practical, then you're able to progress into the field.
And did you succeed through the EMT training?
Yes, sir.
At that point, did you decide you wanted more training? You want to proceed through the profession?
Yes, sir. So after a little while, I worked for about 1.5 years in the field and decided that I genuinely enjoyed the work that I was doing. I then made the decision to progress to the paramedic level. That's a significantly more challenging academic portion. And
Can you briefly share with us a little bit of the training that you needed to complete to be a paramedic?
yes, paramedic training is about, I would say, generally takes people about 2 years to complete. There's about 1 year of classroom. It delves far deeper into not only diseases, but how they interact with multiple body systems, multiple different treatment modalities that we can pursue, multiple different interventions, a whole host of medications, far more medications than a BLS. As a paramedic, I have a much wider range of drugs that I would be able to select to treat different patients.
As you worked through your training and got this experience, did you ultimately become employed by the Canton Fire Department?
Yes, sir.
What did they hire you as?
They hired me as a firefighter paramedic.
And so you were both a firefighter and a paramedic.
Yes, sir.
Does the Canton Police Department, in their units, do they include paramedics and firefighters in the same division?
The Canton Police Department? Or the Canton Fire?
The Canton Fire Department.
Canton Fire Department, the vast majority of the employees of the Canton Fire Department are paramedics. I believe there are I want to say 5 EMTs, but now as a requirement to remain employed by the Canton Fire Department, you have to become and maintain a paramedic certification.
So when you would go to work as a firefighter or paramedic, was it always the same, or did you get assigned as a firefighter one night and a paramedic a different night?
So we would cross-man trucks. We were always fire suppression personnel, but we were also cross-trained as paramedics. So for example, if a fire call were to come in the town of Canton, and I was assigned to ambulance 1 for the day, I would take all my equipment off ambulance 1 and I would transfer it to ladder 1, and then we would take ladder 1 to the fire call and operate as fire suppression personnel. If a medical call were to come in, I'm assigned again to ambulance 1, then we take on the role as EMS. I take my paramedic skills and put them to work in the town on ambulance 1.
Let me ask you one more background question about how the Canton Fire Department works. When there's a call, an emergency call, is an ambulance sent with other vehicles or alone to the call?
Yes, sir. It's typically the engine of that district and the ambulance of that district. Depending on call volume, that can change. But if all is not to use the word quiet, it's kind of a taboo word, but if all is everybody's in quarters and there's a dispatch in District 1, it'll be Canton Engine 3 and Canton Ambulance 1, and they go as a unit together.
Mr. Nuttall, I want you to take us back, if you would, to the early morning hours of January 22nd, 2022. I want you to bring us a little bit before 6 a.m. Do you remember what you were doing?
Yes, sir. So that particular morning, I arrived at work earlier than I normally do. There was inclement weather that morning. So I left earlier than normal just to get in before the roadways got particularly difficult to travel, and to relieve anybody that may need to get out if they needed to get home before the roads got particularly bad. I arrived just before 6 a.m. I was walking in. I was assigned to ambulance 1 for that oncoming 24. I was scheduled to be there at 8 a.m.
Could you share with us a little bit about how the weather was as you arrived around 6 a.m.?
It wasn't great. I was driving. It's about a 35-minute ride for me to get to Canton. The roads were starting to they weren't great. They had been treated, but they weren't pristine. The wind was starting to pick up. The snow was starting to come down a little heavier, which is the reason that I left at the time I did.
And so I may have misspoke. January 29th, 2022, that morning, around 6:04, did you hear a tone or did you hear an alarm?
So the tones went off right as I entered the building.
Tell us what a tone is.
So the tone is the emergency alert tone. In the town of Canton, we have 3. We have 1 for fire, we have 1 for investigation, and we have 1 for EMS. The EMS tones went off and the lights came on. Whenever the tones go off, the lights come on as well. I was just walking into the building when the tones went off and the lights came on.
And is there information that accompanies the tone, information about the call that needs response?
Yes. So after the tones had cleared, there's an overhead dispatch, which is our dispatch center, communicates to us before we get in the trucks and on the air responding. Basic nature of the call. In that particular instance, we were dispatched to an unresponsive male in a snowbank with no real further information to follow up on.
So what do you do?
So as I said, I arrived pretty early that morning. But hearing that dispatch and that nature of the call, those typically tend to be more involved, both personnel-wise and work-wise. The crew that was working that morning was getting on the truck, and it was firefighter paramedic Anthony Flamati and firefighter EMT Matt Kelly. Matt Kelly has since become a paramedic, but at the time he was an EMT. So off the bat, that crew, not to say that they were at a disadvantage, but paramedic Flamati was the only paramedic on that ambulance.
What did you do?
So I made the decision. I checked with the shift commander, and I jumped on ambulance 1 to just give a second set of hands as being a paramedic myself, just being able to hopefully help if there was any advanced interventions that needed to be done or needed to be performed.
What
and
happens?
just a second set of hands.
What happens next?
So I got in the back of the truck. I was actually still in civilian clothing at the time because I had just walked in the door. So I got in the back of ambulance one in the patient compartment. The other two gentlemen were up front driving to the scene. I actually had to don my turnout gear because, again, I was in civilian clothing. I wasn't quite ready to go. So I had to put all my structural turnout gear on and then my can fire jacket. Once I was sufficiently dressed for the call, I started prepping all the gear that we might need for a call such as that, for an unresponsive male in the snow. In this case, it was our first in bag, our airway bag, and our cardiac monitor. Everything was all together. They're all in three separate bags. But on the way there, I just got in. I didn't know how their night had gone. So I just took a real quick look at everything just to make sure everything was there and everything was exactly how it needed to be. So I was able to just grab all three bags, put them on my person, and get ready to, so as soon as the ambulance was on scene, just step off and go to work.
Not knowing much information about what you're going to confront, what goes through your mind as you prepare before you get off the ambulance?
Just basic scenarios. I mean, again, unresponsive male in the snow could mean several things. Not having much to go off on the dispatch was, it left much to be desired in terms of what we might need. So in gathering all the equipment together, that can kind of cover all the major bases, if you will, in terms of what we were expecting to meet once we got on scene.
How was your focus before you get off the ambulance?
I was ready to go. A dispatch like that, any unresponsive male in the snow, it can kind of up the level because you just don't know what you're walking into. You know, it could be anything.
In the back of the ambulance, you can't see outside. Could you tell anything about the weather conditions based on the way the ambulance was moving?
Again, being in the back, as you noted, it just seemed to be taking a little bit longer than normal. I really had no visibility at all. Like I said, I was in the patient compartment. It's very limited visibility in the back, and it's limited visibility. There's like a peephole that's maybe 1.5 feet by 1.5 feet to kind of peek up front. But again, I was so busy getting everything together, I really didn't notice, but I did note it took a little bit longer. We were going not slow, but we were going cautiously.
When the ambulance finally stopped and the doors open, tell the jury what you see.
So as I mentioned, I had the 2 bags and the cardiac monitor. So 3 pieces of equipment with me. And I stepped out of the back or the side of the truck. There's a back compartment or a back door and a side door. I stepped out of the side door. And I immediately noted the wind had picked up and the snow seemed to be heavier. And I could hear like a distant screaming off in the distance. Wasn't exactly sure where it was coming from.
What was the visibility like?
It wasn't great. It was still dark out. The sun had not come up yet. The snow was coming down, as I said, heavily. And it wasn't great all around.
Was it cold?
It was cold. Yes, sir.
And so when you hear the screams, what do you do next?
I started making my way kind of towards the sound, following the sounds. I couldn't see anybody yet. So I just kind of followed the sounds. And then once I was able to get around the side of the truck, that's when I was able to see a group of 3 individuals with Canton police. And I started making my way over to them to see where the patient might be located and what was going on.
As you get closer, tell us what you see.
So as we approached the scene, as I said, there were 3 individuals and Canton police were on scene as well. And then there was what appeared to be a human figure laying supine in the snow. I'd say about 6 to 8 feet, kind of where the sidewalk met the front lawn of a residence.
What does supine mean?
So he was laying on his back.
Okay.
From there, I made my way directly over to that individual and started checking for signs of life.
How do you check? Do you get close? Do you get down on the ground?
Yep. So I knelt right at his head. Typically, to check for any signs of life, it's just as you see in TV or anything like that. You check the carotid pulse, and you check for any signs of breathing or anything like that.
Where's the carotid pulse?
So the carotid pulse would be right in the neck. Like and just real quick, 2 seconds, you can check either side. They're on both sides. Those are the strongest pulses that you can grab quickly. So I just real quick went
You
right
know
to
why
that
that
gentleman.
is?
Like I said, I looked for any signs of breathing. I found none. I checked a carotid pulse, and I found none.
How was his skin to the touch?
He was very cold to the touch.
He wasn't warm?
No.
And so after you touched his cold skin and you felt the carotid artery, is that how you
Yes, sir. Carotid artery.
Did you come to any initial quick assessments or conclusions in your mind?
So I found, like I said, I checked for signs of life, the carotid, the signs of breathing. I found none. From there, we had ascertained that there is no signs of life. As I was checking that, the other two individuals on the ambulance came and met me, and they began doing the same thing just to check. I mean, sometimes you can look and you can miss. So the other paramedic, Anthony Flamati, started checking my work, and then we kind of went from there. But I found no signs of life in my initial.
So firefighter paramedic Flamati arrived to this person after you did?
Yes, sir. I was the first one to actually put hands on the individual and check for signs of life.
Did you later learn the name of this man?
I did.
And what was that?
John O'Keefe.
After you found no signs of life for John O'Keefe, did you get up and go to speak to anybody?
I did. So as being a second set of hands on the call, it's really not my call, like in terms of treatment modalities and how we want to progress. So after I found no signs of life, I kind of got up to kind of look around real quick. I went over to the individuals, the three individuals that were there, and just said, hey, I just have found no signs of life. We're going to see the next steps. And as I was saying that was when Anthony Flamati, who is the lead paramedic on this, made the decision this is a workable cardiac arrest.
Let me ask you two questions. The first is, as a paramedic firefighter, are there times when you're the lead paramedic on a call?
Yes, sir.
And so it changes call by call, but this one was firefighter or paramedic Flamati's lead?
Correct. He was the lead paramedic on this call.
There are other times when you're the lead and firefighter or paramedic Flamati is on your crew and you lead?
Yes, sir. So we typically switch off. We'll do one, and then once my rotation is complete, we'll do the next one. So it's patient for patient, typically.
When firefighter paramedic Flamati called you back and said it was a workable situation, can you explain to the jury what that means?
Yes. So in medicine, there is a term that is you're not dead until you're warm and dead. Meaning your core temperature, your core body temperature has to be
bring you back
within
up.
normal limits for it to be considered a futile attempt at resuscitation.
Wait, what?
They have to literally legally bring your body temperature back up to within a normal range. They can pronounce you.
Makes sense.
Actually, that sounds like a good idea. I might do that too. A coffee. Two.
Okay.
2:15. You keep going. That's all good. I should get up and have a switch too. You've got the control anyway.
Yeah.
Haven't you?
Yeah.
I'll be back.
All right.
Oh.
Enjoy your coffee.
Noting that, Tony, the other paramedic, Tony Flamati, realized that this gentleman was very cold to the touch and that this was now a hypothermic cardiac arrest, or a cardiac arrest in a hypothermic setting, which means as providers, we have a duty to initiate life-saving measures, CPR, ventilation, and continue those efforts until we get him to a hospital and a physician is able to take over and they are able to monitor his core body temperature for a certain amount of time.
I want to ask you about a term you used. You said a hypothermic situation. As a firefighter paramedic treating a patient at the scene, you're not diagnosing hypothermia, are you?
No, sir.
So you're not making a medical diagnosis. You're just saying it's a hypothermic situation because of why?
Just because of the conditions. He was extremely cold to the touch, and he was in in the elements. We didn't know how long, so taking the fact that he is extremely cold to the touch and he had been outside for an unknown amount of time, that quantifies it to us as a hypothermic arrest or a cardiac arrest in a hypothermic setting.
But is there anything about Mr. O'Keefe's fingers or hands or his face that gave you any indication if he had been there just recently or had been there for a while?
His fingers were quite cold. They were not well perfused at all. They were very.
Mean? I don't know. What does not perfused mean?
Sorry, there did not appear to have been any blood flow at all. Just because he was, again, presumably being outside, his fingers were very, very white. They were very stiff, which can be signs of hypothermia and frostbite. And again, touching the neck. So typically, when you get cold, you kind of work back from your extremities in. So again, I noted his fingers were quite cold, but also when I checked his carotid, his neck felt quite cold as well. That just kind of tipped us back further down the road of a hypothermic cardiac arrest.
I see. When firefighter Flamade called you back,
yep,
where did you go exactly?
So when I was told that this is what we're doing, I turned around and I went right back to where I previously knelt, which was right at Mr. O'Keefe's head. And then I took over the ventilation aspect of a cardiac arrest. So I was in charge of the airway. So I began giving him positive pressure ventilations with that valve mask, which is just a glorified balloon that you can push oxygen through and down into your respiratory tract to get oxygen moving. While I was doing that, I believe firefighter EMT Kelly had begun CPR.
So is this fair to say it's a team effort?
Yes, sir.
A coordinated effort?
Very much so.
And depending on where you're placed, whether in the back of the ambulance or driving or leading, does everybody have an important role to play?
Yes. Yeah, we work in conjunction with each other. Typically, the most well-defined roles in a cardiac arrest in EMS is your airway monitor, which is myself in this situation, and then your cardiac and medication administration, which is, that would be Anthony Flamati, that would be Tony. Just because of my position at the head, I just took over the ventilation aspect, and that was where I remained throughout the call.
You said you went back to try to help Mr. O'Keefe, and you were giving, helping at the airway. Do you have to actually get on the ground to do that?
Yes, sir. I was kneeling at his head.
While you were kneeling at his head, well, let me ask you more of a background question. Is it helpful to get information about the history of the person when you're trying to treat them when you happen upon a scene and you don't know the history?
Yes, sir, very much. Getting information on medications, history, and allergies is our top priorities in any call, not even this call, just really any your run-of-the-mill fall or chest pain. Typically the first questions that we ask: what medications are you on? What medical history do you have? Do you have any allergies? The medical history is important because if you've had heart attacks in the past, or just using a generalized example, if you've had heart attacks in the past, does this feel like a previous heart attack? It kind of gives us something to go off of.
As you were nailing, I want you to take us to that moment. As you're nailing, trying to help Mr. O'Keefe, did you have a chance at any point to look up?
I did.
And when you looked up, when you were trying to help Mr. O'Keefe, can you tell us who you saw?
I saw a middle-aged middle-aged female with blood on her face. And I, real quick, as I was in the process of providing ventilations, I said, do you know this person?
The person that you looked up and saw that was standing over you with blood on her face, do you recognize that person in this courtroom?
Yes, sir.
With the court's permission, sir, could you point out that person that you looked up and saw?
In between Mr. Jackson or next to Mr. Jackson.
I see. And when you looked up and saw that person and asked about any background, what did she say to you?
I hit him. I hit him. I hit him.
How clearly do you remember her words saying to you, I hit him, I hit him, I hit him?
I remember it very distinctly.
You've been to a lot of calls over the years and since.
Yes, sir.
Would you say hundreds or thousands?
Thousands.
Do you remember all of them?
I remember aspects of various calls, but not all of them, no.
Do some stand out more than others?
Yes, sir.
Did this particular moment stand out more as compared to your typical or most calls that you've been to?
It did, just because of the setting. I mean, it was the weather, it was the unknown factors, and it was the attempting to try and get information and not really being able to glean anything from that.
After the defendant said to you, I hit him, I hit him, I hit him, did you ask any follow-up questions?
I really didn't get a chance to, because following that, the individual just kind of walked away, or just kind of went in a different direction. I wasn't able to ask any follow-up questions.
Have you ever received any police training?
No, sir.
Are you a police officer?
No, sir.
When you're helping a patient, do you have any interest in detective work?
No, sir.
Do you have any interest in investigating potential crimes?
At that time, in this particular instance, because I was at the airway, that is a pretty critical aspect of a cardiac arrest. I was stuck there. I couldn't get up and kind of follow up on that at all. I was there doing that ventilation.
Is it your job to investigate cases, or simply to get information to help treatment?
Just the information.
When you go out as a firefighter paramedic, do you have a purposeful cause?
Yes, sir.
And what is that?
To save lives.
And is that your only focus?
In this instance, it was attempting to restore circulation and breathing.
At some point with your colleagues, did you lift Mr. O'Keefe from the ground?
We did.
When you lift him, what do you put him on?
So we put him on, it's called a scoop stretcher. It's basically just a hard plastic moving device with some seatbelts on it, just to get the patient up and onto the stretcher. And then from there, we can move from the stretcher to the ambulance.
After you lift him to the stretcher, tell us what happens next.
So we put Mr. O'Keefe on the scoop stretcher, and we were able to get him onto the stretcher itself and then off to the ambulance. From there, I maintained my role as the airway individual on this call. So we made our way to the ambulance. I got in the tech seat, which is directly behind where the stretcher locks in. So I had access to the airway again. I was continuing to provide positive pressure ventilations to Mr. O'Keefe, and we had put in an OPA as well, which is just a plastic hook, if you will. It just keeps the tongue from falling back into the airway, so we can continue to provide positive pressure ventilations. Once we got him in the truck and we continued that effort, we set up a suction system, and we prepared to intubate Mr. O'Keefe. We prepared a suction system just because as I was ventilating outside of the ambulance, there were some secretions in the airway that I could see, and you could kind of hear it as you go to squeeze in breaths into the individual. You can kind of hear the secretions kind of getting like bubbly and stuff like that. So we knew we were going to need to suction him. So we got him in the truck. We really quickly suctioned him, and then we were able to intubate him successfully to definitively give him an advanced airway and give him better ventilations, get more oxygen into his system.
Now, you mentioned that he wasn't warm, he was very cold.
No, he was still very cold.
What does the team do to try to assist with that?
The most basic thing that we did, we turned the heat on as high as it would go. We also stripped all of his clothing off, just getting all of that wet clothing off of him. I didn't really have a role in that particular part of it, just because once you're on the airway, that is kind of yours. Nobody can breathe for him. So every time I squeeze that bag, he gets a breath. So I'm kind of tied to that airway for the duration of the call.
So when your colleagues are stripping the clothes off him, is your attention on the clothes or more on the airway in your job?
No, I'm maintaining the airway. If an endotracheal tube is dislodged for whatever reason, it is typically more difficult to get one in. So the integrity of that tube staying where it is and not being dislodged, that is another key aspect of airway management.
As you're doing that, do you notice what anybody else, any of your colleagues are doing to help?
Like I said, they were working on clothing removal. I believe they were also getting intravenous and intraosseous access on this individual to begin medication administration. But again, I was quite focused on that airway, just making sure that it was maintained and we didn't lose any tube. We didn't lose any end-tidal CO2, which is just another monitoring device that we use to confirm that that tube is in place.
How quickly do you get to leave the scene and start moving towards the hospital?
I honestly couldn't give you an accurate estimate. It didn't seem to be out of the ordinary realm, though. We were able to move within the flow.
In addition to Mr. Keefe being very cold, did you notice any other injuries on him?
So I noted that he had a hematoma right above his right eye.
Could you explain to us what that is?
Yep, it's just, for lack of a better term, it's just a big egg. He had a pretty good bump over his eye.
And you said his right eye.
Yes, sir.
Did you know how that hematoma was caused?
No, sir.
No idea?
No.
In addition to the hematoma above his right eye, what other injuries did you see?
There were also several scratches on his right arm, just below his shoulder and traveling down his right humerus. They terminated right about his right elbow, just above it.
Those scratches, have you also described them as abrasions?
Yes, sir.
Is there any difference in your mind, difference between scratches and abrasions?
Nope. These were they were deep and they were not bleeding, but they were notably deep.
Did you ever describe it as furrows?
I did.
And in describing those scratches, do you have any idea how they were caused?
No, sir.
Okay. And did you notice any other injuries on Mr. O'Keefe?
No, sir. Those were the only ones that we noted. As I mentioned, we suctioned a little bit of blood out of the back of his airway as well. I believe it was blood, mucus, and saliva. But those were the extent of the injuries that I was able to note.
Did you notice anything about the back of his head?
Actually, yes, I did. I apologize. There seemed to be a little bit of matted blood around in his hair around there. Really didn't see anything too obvious at the time. He was also placed in a cervical collar as well, following intubation, and that was kind of there just to maintain his cervical spine. But there was, like I said, there was noted to be a little bit of dried blood on the back of his head.
At some point, did you finally make your way with Mr. O'Keefe to the Good Samaritan Hospital?
Yes, sir.
And just share with us what happens when you get there.
So after we got there, we handed off care to Good Samaritan Medical's physicians and ER nurses. We were able to give a report to the physician of just basic what we've done, what we've given for medications, in my case, what he was intubated with and how he was being ventilated and how well he was being ventilated, and any other further pertinent information. Typically, we noted that Tony was the lead paramedic, so that is typically he kind of holds the room for a minute when we get in there and gives a big rundown, and then we back off and let Good Samaritan take over.
When the defendant told you that she hit him, did that have any significance to you?
No, sir.
Did it reconcile with the injuries that you saw before you that Mr. O'Keefe was suffering from?
No, sir.
And so at that point, was that information insignificant in perspective of your care?
Sustained.
Okay. What role did that information play in your care after the defendant told you she hit him? How did that contribute or not contribute to what you were doing?
It really didn't help at the time. Again, I wasn't able to chase anything down from that. I just kind of took it, noted it, and moved on with my aspect of the cardiac arrest.
Okay. Have you had an opportunity at any point to see any video of that morning taken from any source, a police car, dash cam?
Yes, sir.
Okay. All right, I'd like to introduce a video stream.
Okay. So this will be in evidence. There are agreements with some of the evidence already?
I believe there's no objection, but I don't want to speak for the defense.
Okay, thank you. Yes, you can show it.
And for the record, if I may note, this is Cruiser 683 Stream 2.
I'm sorry, what?
I'm sorry. It is Cruiser 683 Stream 2. I'm going to ask to play a portion of it that's relevant to Mr. Nuttall. Ms. Gillum, if you would please move to 6:11 a.m. Please stop the video. Mr. Nuttall, do you see the red lights reflecting on the left?
Yes, sir.
Do you know what those red lights are?
Presumably those would be ambulance 1.
Yeah, so not what you presume. Do you know what they are, sir?
And those are the lights for ambulance 1.
Do you see the weather conditions as it's depicted on this video?
Yes, sir.
Oh, as you stood outside, was it same or different to how it appears in this video?
That is the same.
When you look to the left, you see a straight line about an inch or two from the left of the screen. Do you know what that item is?
Sorry, sir. Repeat the question.
If you look to the left of the screen,
Yep.
you'll see a straight item from the bottom halfway up the picture. Do you know what that item is?
I believe that's a flagpole, sir.
Do you see a little bit of movement of bodies near that flagpole?
At the present time, no.
Okay. Could we continue to play, please?
Yep, there they are.
Could you stop, please? Did you see the first person in line now behind the person with in front of the person with the blue hat?
I'm sorry, sir. Can you back it up like 10 seconds?
Certainly. Keep going, please. Do you know who that person is?
I believe that's me, sir.
Okay. Could you please continue? Is this your first assessment?
Yes, sir. This is ascertaining any signs of life or breathing.
Is that you approaching?
Yes, sir.
Could you stop, please? After informing you return, is that after firefighter Flamati called you?
So right after that, when I turned around, that was when Tony said, "Hey, we're working this."
Okay. Please continue. Stop, please. And do you see a person come over to where you are?
Yes, sir.
Is it at that point or another moment when the defendant said, I hit him, I hit him, I hit him?
It was right there, sir.
Could you continue, please? Could you stop for a moment? There's no voices or noises from people coming through that audio. When you were there that night throughout the event, was it silent or were people speaking? Did you hear people speaking?
There was, as I noted when I got out of the truck, there was quite a bit of screaming. It was quite chaotic. The wind was also a factor, but there were people around. They were speaking within themselves too, but there was screaming, there was wind, and there was different side conversations as well.
And when you were working on Mr. O'Keefe, were you having conversations with your colleagues?
Yes, sir.
They're not picked up on the audio?
No, sir.
Please continue. Sir, are you still at the flagpole?
Yes, sir. I'm kneeling at the head of the patient.
Are you included in that group of first responders?
I am not, sir. I have actually exited to the side with the bags. I believe I'm entering the ambulance at this point.
Okay. Thank you. We can conclude the viewing. With the court's permission, I'd like to approach and show a few exhibits to Mr. Nuttall. They've been shown to the defense.
Yes,
Thank you. May I approach?
yes.
Thank you. No objection. Okay. Can I show you a photograph?
Yes, sir.
Sir, do you recognize what's in that photograph?
Yes, sir. Those are the scratches on Mr. O'Keefe's arm.
Does that appear the same as when you saw his arm that morning, or is there any differences? And if there's any differences, can you share them with us?
That appears how they were to me at the time of the incident.
Okay. May I approach again, Your Honor?
Yes,
I'd like to introduce this as an exhibit, please.
okay.
Here also.
I'm going to hand you a.
Hold on.
I'm sorry.
Thank you.
Pardon me, Your Honor. May we publish to the jury?
Yes,
Is that the photograph you just identified on the screen?
Yes, sir.
Showing you a second photograph, I'd like to ask you some questions about it.
can we take that one down, Mr. Brennan,
Yes, of course.
please, Ms. Gilman?
Thank you. Does that photograph, do you recognize that area?
Yes, sir.
Is that the same or substantially the same area where you helped try to treat John O'Keefe?
Yes, sir.
Does that look to be a fair and accurate representation of the area?
It does.
With the court's permission, I would introduce this as an exhibit, please.
Okay, and there's no objection to any of these three?
None.
Okay, yes.
Thank you.
Thank you.
With the court's permission, could I publish exhibit 2?
Yes.
And sir, that's what you recognize as the area where you were helping to treat John O'Keefe.
Yes, sir.
I've left one last photograph in front of you.
Yes, sir.
And do you recognize that?
I do.
Tell us about any differences between when you were there and what you see in that photograph.
The street appears to be plowed. There's bare pavement. The weather conditions are significantly better. It is also daytime.
If we could take down that exhibit 2, Ms. Gilman. May I approach, Your Honor?
Yes,
I would move to introduce this as exhibit 3.
all right.
With the court's permission, I'd like to publish exhibit 3.
Sure.
Is that the photo you just identified?
Yes, sir.
Okay, we can take that down. Thank you. Thank you, sir. I have no further questions, Your Honor.
All right. Jackson?
Did I miss anything pivotal?
No, it's just exactly what you'd expect. Basic recitation of what happened.
He was witness number 5 in trial 1. So when he's finished his cross, I'll see if I can upload it. I'll see if the transcript's ready.
He's not really one of the interesting witnesses, to be honest.
No, but he's the only one that is stating that he heard that I hit him. Because
Yeah.
Jen McCabe didn't say that in a grand jury testimony. So we're at cross now, yeah?
Yeah.
Thank you, Your Honor. May I?
Yes, please.
Good morning, good afternoon, Firefighter Nuttall.
Good afternoon, sir.
Nice to see you again.
You as well.
Before your testimony this morning, how many conversations had you had with any member of the prosecution team in anticipation of your testimony today?
I believe it was 3, sir.
When were those?
I could not give you dates off the top of my head.
Give me a time frame. Within the last 3 weeks, from the last 3 months, last 3 days?
Within the last 3 weeks, I believe one the week after that, and then one last night.
One?
Last night.
Last night. What you did discuss, let's take them in order. First of all, who'd you meet with 3 weeks ago?
I met with Mr. Brennan and his staff.
And when you say his staff, who else?
I honestly couldn't tell you, sir.
Mr. Lally?
No. No, sir.
Male, female?
One female, one, I believe, state trooper.
Okay. Had you ever met State Trooper Tully previously?
Yes, sir. Actually, I believe that was him.
It was State Trooper Tully?
Yes, sir.
Whom you've met with several times, correct?
Prior to that, I believe only once or twice.
He was the one that he has formally interviewed you previously, correct?
I believe he arranged the meetings with Mr. Brennan,
Okay.
but beyond that, I can't speak to.
What did y'all discuss 3 weeks ago?
The first meeting, going in order, it was mostly just kind of an introduction. I had not met Mr. Brennan yet. I really didn't know him. So it was mostly that, and then just kind of seeing where we were at with testimony, going over previous testimony and in that sort of realm.
Prior to today, how many times have you testified under oath concerning the incident on January 29th, 2022?
Once at a grand jury hearing and once last year.
All right. As a matter of fact, last year in this courtroom.
Yes, sir.
Okay. Did you look over your testimony at the grand jury 3 weeks ago during that meeting?
No, sir.
What about the testimony from last year?
We did go over the testimony from last year. Yes, sir.
Were there any issues that Mr. Brennan or anybody else in that meeting brought up concerning any of your testimony?
There was just a question of how many times the I hit him came up. It was 3 times.
And were you advised that that's not what you said at your testimony last year?
No, sir.
2 times?
What was that?
You said it was 2 times last year?
I honestly can't recall, sir.
Okay, but you just saw that, or you just read that and went over that 3 weeks ago.
I believe so, sir. Yeah.
But you can't remember, as you sit here today, just 3 weeks ago, what y'all discussed in terms of how many times you previously testified that you heard the phrase, I hit him.
So previously testified possibly to 2, but it was 3.
Okay, your memory is clearer now than it was, for instance, a year ago when you testified.
Repeat that?
Sure. Your memory is clearer now, as you sit here, that it was 3 times you heard that, than it was a year ago when you testified that it was 2 times.
Yes, sir.
Yep.
Okay. Does your memory get better with time generally? Your memory. I'm not talking about the royal you. I'm talking about you.
In certain settings, I mean, there are certain things about different aspects that I recall better than others.
Okay. And does your memory tend to get better or does it fade over time? That's my question.
It can fade over time, but it depends on the context.
But in this case, you're telling this jury that your memory is better now than it was a year ago when you testified about the exact same circumstance, correct?
Yes, sir.
Okay. You then met about a week after that, which would be 2 weeks ago.
Yes, sir.
Who'd you meet with then?
The same group.
And what did you discuss at that meeting?
Again, just prior testimony, and that was really the gist of it.
And tell me the specifics of the prior testimony that you.
Again, it was the how many times we had talked about saying I hit him. Again, it was 3 times. And then there was also the video that was just played for me.
If I'll take the video in just a second. If y'all had met 3 weeks ago and you indicated to Mr. Brennan that it was actually 3 times, not 2 times that you heard the I hit him, why did you need to discuss it again a week later to verify the 3 times versus 2 times?
Not sure, sir. That was just the way that the conversation went. And I just, again, repeated what I said and what I remember from that morning.
Well, tell me about that conversation. Did Mr. Brennan say anything like, well, are you really sure that she said it 3 times?
It was that morning what was said to you. And I said, I hit him. That was how it went that morning, and that was how I remember it.
Okay. And did Mr. Brennan say, well, that's not consistent with how you've testified previously concerning the number of times you heard the I hit him phrase?
Yes, sir.
He did say that.
He wanted to, he acknowledged that I had said it twice. However, again, as I mentioned, it was said 3 times to me.
So now you do remember last year that you only said that it was repeated twice.
One more time, sir.
So now you do recall that last year when you testified, it was inconsistent with how you're testifying today. Let me put it that way. Correct?
I believe I said I hit him twice on the stand last year.
Right. And if you're saying I hit him 3 times instead of twice, that firefighter NUTTAL is inconsistent with your testimony today, correct? You
Yes,
agree
sir.
with that?
But that is how it went that morning, sir.
Okay, that's not my question. Let me see if I can do it again. So I'm asking you, if you testified last year
Yes, sir.
that you heard the phrase twice, and now a year goes by and you're testifying in front of this jury this year that you heard it 3 times, those 2 statements are inconsistent with one another, correct?
Yes, sir.
Okay. Did you talk at the meeting 2 weeks ago about any other inconsistencies with your testimony?
Not to my knowledge, sir.
Well, you were there, and you
No.
say not to my knowledge, meaning,
No, sir. We did not.
okay. So it was just about the number of times that you heard the phrase, I hit him, correct?
Yes, sir.
All right. You cleared that up in the 2 meetings, 3 weeks ago and 2 weeks ago. What did you talk about last night?
Mostly just making sure that everything was as it had been. I mean, and by that, I mean, it was 3 times, and that we were continuously making sure that everything was the way that it had happened that morning.
Everything was the way that Mr. Brennan wanted it to be.
No, sir. The way that it was I remember it, and I recall it happening.
Okay. So he asked you 3 weeks ago about how many times you heard that phrase.
Yes, sir.
You changed your testimony at that time and said it was 3 times instead of 2 times. We agree on that, correct?
Yes, sir.
Then he called you a week later, or met with you a week later, and again reiterated, making sure you stick with that testimony that it's 3 times, not 2 times, correct?
Yes, sir.
And then last night he called you just to make sure one more time you're going to stick with that testimony that it was 3 times, not 2 times, correct?
Yes, sir.
Hold on just a second. May I have just a moment, Your Honor?
Yes.
Apparently, this particular software that I'm using is what the paralegals and stuff use to actually go, all right, how many times did you say I hit him? Because that's pretty much what I just did. Came up exactly what he's saying.
Yeah, but I don't get why the defense is making a big thing of this.
I don't know.
It doesn't make any difference whether he heard it 3 times or twice. All you're doing is establishing, okay, he definitely heard it, but we're not sure how many times he heard it. And the defense doesn't want anyone to have heard that in the first place.
And the more times he asks, the more times he's saying it, the more it's going to resound in the jury's brain.
Yeah, it's just this defense are idiots. It's like they almost want to get her convicted. I mean, I think she did it, but she at least deserves a decent, competent defense. Not this bunch of morons. I can understand why there is a growing thing that after this trial, these lawyers are facing stuff from the bar
Okay.
about whether they will ever be allowed to be lawyers again.
Where do you get that from?
There are anonymous sources from the bar that they're not amused with the conduct of her defense team. But it's
The bar's statewide. The bar in America, is that statewide or
Yeah.
Okay. And when you talked last night, did you assure Mr. Brennan, nope, nope, nope. When we come in tomorrow, I'm certainly going to say it was 3 times, not 2 times.
No, sir. I told him I would tell my recollection of that morning.
Okay. And did you tell him that what my recollection is, I'm going to tell the jurors it was 3 times that I heard it?
That was what I heard.
Okay. Did you tell him that's what you were going to say today?
No, sir.
You didn't?
I told him I was going to tell him what I remembered from that morning.
Which was what?
I hit him.
Which is how many times?
3 times, sir.
And that's inconsistent with what?
I believe a year ago.
Okay. Now, you also talked about, I want to get back to the other thing that you talked about. You said that at some point, either in the meeting 3 weeks ago, the meeting 2 weeks ago, or the meeting last night, you were shown a video.
Yes, sir.
Which one of those meetings were you shown a video?
I believe the same.
Okay. Were you shown the entire video?
No, sir.
Just the clip that we saw?
Yes, sir.
Okay. What did y'all talk about in relation to that video?
Mostly nailing down who was who in that video.
Okay.
Being the other personnel on scene, where I was, and that was about it.
He showed you the clip that you showed. He showed you the clip that you just seen on direct examination, correct?
Yes, sir.
Did you tell him where you were?
Yes, sir.
Did Mr. Brennan ask you to define exactly where it was that you supposedly heard this phrase, "I hit him"?
No, I was able to give that to him, sir.
Okay. And what you told him was that moment when you see my client walk over sort of to the left of the screen, correct?
Yes, sir.
And you defined, that's the point at which she said, "I hit him, I hit him, I hit him."
Yes, sir.
And that's in response to your question. I want to make sure I'm clear about this. You asked, "Do you know him?"
Yes, sir.
And she repeated the
Why
phrase
would
3
you
times.
answer, "I hit him, I hit him, I hit him"?
Correct.
Okay. We'll talk more about that in just a second. Did Mr. Brennan ask anything else about that specific video?
No, like I said, he kind of asked me to point out different individuals on the scene, and that was really the extent of it.
You saw that same video last year when you testified, correct?
No, sir.
You didn't see it last year?
Not to my knowledge, no.
In preparation for your testimony last year?
I did not.
Did you see it before your grand jury testimony?
No, sir.
Okay, so this is the first time that you've seen it.
Yes, sir.
And you were able to establish for Mr. Brennan exactly when it was that you believe you heard the statement based on your view about 2 weeks ago of that video.
No, that was the way that I remember it.
Right, not a trick question. My question is much more simple. You were able to establish after than 3.5 years now, exactly where you were and where Miss Reed was and who else was around at the time that you believe you heard those 3 statements in order. I hit him, I hit him, I hit him.
Yes, sir.
Okay. You testified last year as well that there is a normal protocol for removing clothing from a patient. And it's essential to just discard it and get it away from the patient so that you concentrate on the life-saving measures that you're undertaking, correct?
Yes, sir.
That could be done you said in the ambulance, it could be done in the hospital, it could be done in situ, out there in the field, correct?
Yes, sir.
But the point is you want to get as much clothing off of the person as possible so that you can assess that person's physiology.
Yes, sir.
Not really the proper context, but
It's not really a lot of care taken to preserve the clothing from an evidentiary standpoint in your view, correct?
And we're trained to try and, just to take example of a shooting, try not to cut through the entrance wound of the clothing.
Fair enough. Fair enough. I mean, when you're literally trying to save someone's life, your job is to get the clothing off and get it out of the way.
Yes, sir.
You're not sticking it in an evidence bag and sealing the evidence bag, things of that nature.
No, sir.
So it might end up on the ground.
Yes.
Right? Might end up with some debris on it.
Me. It's me.
Apparently,
I'm in control.
the reason they, the defense were highlighting this is because in his testimony last year, he changed his account and said that he only said it once compared to his February 8th interview with Trooper Proctor. And then he testified to saying twice, and now he's saying it's 3 times, apparently.
I still don't think it's a wise strategy.
Failure
To
to
go after.
report. He didn't mention that to anyone. Medical report, didn't write in his report. Hospital staff didn't report it to police or state police at the time. His statement was presented by the prosecution as a direct admission. Timothy Nuttall's testimony specifically claimed the phrase was repeated 4 times. So, yeah. Context discussion. Cross-examination raised the possibility statement could have been a question. Could I hit him rather than...
Might end up on the floor of the ambulance.
Yes, sir.
Could end up in the floor of the hospital.
Wait,
Or on
did
the
that
floor of the hospital. Is
restart?
that
I
right?
didn't tell
Yes,
it
sir.
to.
I hate it when it does that. When you hit too close to the play sign and you go up into the line. I hate that.
No, I wasn't even on the right screen. It just randomly started replaying.
Oh. Something's going on because I've not watched Melanie Little for a long time. And I clicked on the open tab and it went straight to her sign. her site. There's something in the water.
Definitely. It's those Americans. Telling you, it's the pesky Americans. They're just out to get us because,
Yeah.
We're not from America.
We don't say y'all.
It's a conspiracy.
Mm-hmm. Yeah.
Okay. And if it's tossed in the floor of the ambulance, the clothing may well pick up debris from the ambulance.
Oh, yeah. Yes, sir.
Or the debris from the floor of the hospital or wherever.
Mhm.
Is that yes?
Yes, sir.
Okay. You testified previously at the grand jury in April of 2022, correct?
Yes, sir. I believe so, sir.
Okay. So this happened in January of 2022, that same year in the springtime. You testified at a grand jury, April 20th, I think it was.
Yes, sir.
Does that sound right?
Yes.
Okay, I want to take you back to that testimony for a second. You testified at that hearing that Mr. O'Keefe was, quote, dressed appropriately for the weather. You remember that?
Yes, sir.
All right. It was obviously well below freezing at that time,
Yes,
that night that you responded.
it was.
We've just seen the video. It looks cold as hell, right?
It was chilly.
All right. The wind was howling.
Yep.
It was snowing.
What are you on?
Is that right?
Yes, sir.
And you testified that John O'Keefe, quote, had a heavy coat on and possibly 2 other layers of clothing.
Yes, sir.
In April
Wow.
2024, you reiterated your very specific memory of and you even called it a puffy heavy coat that he was wearing, which was then removed so that you could assess his injuries, correct?
Yes, sir.
All right. Not to get too colloquial, but a puffy coat is like got down and stuff in it, right?
Correct.
Looks kind of like Stay Puft Marshmallow Man, right?
Yes, sir.
Okay. Pretty distinctive article of clothing.
Yep.
And you testified last year that Mr. O'Keefe was wearing that clothing, which you had to remove or somebody had to remove in order for him to be properly assessed.
I did testify that way. Yes, sir.
Okay. And you mentioned that your memory of that big heavy winter coat was as clear as your memory of other specifics in this case, correct?
Yes, sir.
I asked you that exact question, didn't I?
You did.
And I said, your memory of him having that big puffy coat on, which stood out in your mind, was just as clear as the other specifics that you've testified to about the case,
Yes, sir.
about that night. And turns out you were completely wrong about his clothing, correct?
Correct.
Matter of fact, he wasn't wearing a coat at all.
No, sir.
He wasn't wearing a winter coat, correct?
Nope.
He wasn't wearing a
Don't
heavy
suit up.
winter coat, correct?
Correct.
And he wasn't wearing a puffy, heavy winter coat.
He was not.
Yet you testified that he was wearing all of that, and that was clear in your mind at the time.
Yes, sir.
Yep. Get off the shrooms, Tim.
Did Mr. Brennan bring that up during the meeting 3 weeks ago?
He asked about what I had meant when I said appropriately dressed.
So you did talk about something other than just the I hit him, correct?
Yes, sir.
When I asked what y'all talked about, why didn't you tell us that?
To be perfectly honest, sir, I did not remember until right now.
So your memory is fading even after 3 weeks.
Yes, sir.
Got it. The fact is, well, let me ask you a different question. Did Mr. Brennan tell you what Mr. O'Keefe was actually wearing?
No, sir. Actually, I believe you did.
Last year, didn't I?
Yes, you did.
It's a short sleeve t-shirt and a little thin wool hoodie, right?
Yes, sir.
Wasn't wearing a hat.
No, sir.
Wasn't wearing, as a matter of fact, didn't even have a shoe on, correct?
Not to my knowledge.
And obviously, goes without saying, but I'm going to ask it anyway. That's not being appropriately dressed for the winter.
No, sir.
Yeah. You indicated that you did notice certain injuries on Mr. O'Keefe's person.
Sir.
Once you got him back in the ambulance, obviously it's lighter, meaning brighter lights. You have more equipment in the back of the ambulance. You can better assess somebody's well-being, correct?
Yes, sir.
And you indicated you had a, quote, much better picture of what we were dealing with, correct?
Yes.
You noticed once in the back of the ambulance that he had trauma to the right side of his head.
Correct.
And as a matter of fact, when you were pointing at it, I'm doing that on purpose because you pointed to the right side of your sort of forehead above your right eyebrow, correct?
Yes, sir.
Okay. The majority or the worst injury that Mr. O'Keefe suffered was actually to the back of his head, which you indicated, you noted was quite matted with blood, correct?
Yes, sir.
I want to talk about the injury to the right side of his head as distinct from the back of the head injury for just a second. Before I get to that in detail, let me ask you, because I just sort of want to cover the bases. You noted the back of the head injury, correct? Is that yes?
Yes, sir.
You also noted the front right side of the head above the right eye, correct?
We did.
You noted some injury to his eyes. They looked blackened.
Yes, sir.
But primarily the right eye was blackened.
Yep.
And there was a golf ball size egg, I think you put it over his right eye, often called hematoma.
Correct.
And you also noted when you got his shirt off that he had scratches along the right side of his arm. Is that right?
Sir.
You indicated on direct examination today that you believe those scratches ended where? Meaning from top to bottom? And I'm not using anatomically correct language. So from shoulder to wrist, where were the scratches that you noted?
There were several. As I noted, they were on his right humerus area.
Tell me what a humerus is.
The right arm.
Biceps.
Right about here.
Okay.
No, a little further, like between where your bicep and your tricep kind of meet. Right about in there.
Okay. And what did the scratches look like?
They were deep, infamously referred to them as furrows, but they were quite deep. You could tell that there had been some material removed.
Okay. Material meaning skin and flesh.
Yes, sir.
Okay. Some biological material.
Mm-hmm.
Is that yes?
Yes, sir.
And were they parallel? Meaning they were going in the same direction?
Yes.
Were there any scratches below the elbow?
There were. Yes, there were. They were not as significant as the ones in the upper arm, but they were noted.
Okay. And those were parallel as well?
Yes, sir.
And they look like scratches to you. That's how you describe them.
They did.
Last year, when you described those scratches, you curled your fingers up, exposing sort of the nails, and drew it across your biceps. Is that what you were using to describe what the sort of scratches looked like?
I just kind of used that as a landmark, to be honest with you, sir. It was just kind of how I quantified it in my mind.
Okay, but what you did was you did this motion.
Yes, sir.
As you said, there were furrows, and remember there was an embarrassing moment for me.
Both of us, sir.
I couldn't understand the word furrow because of the accent, right?
Yes, sir.
All right. Let's talk a little bit about the hematoma above the right eye for a second. That's basically damage to subdural blood vessels that causes acute swelling, right?
Correct.
Ready? That's what he's talking about. Sorry. Oh, I can't start it again. That's John's forearm. And that's the raccoon eyes. And sorry, Dan. I bumped you off, I think. My bad. Hello, where'd you go? He's nicked off, hasn't he? Alright, I'll find the I think he's on Law and Crime, yeah. Do 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 do. Oh. Oh, okay. Well, doesn't look like we've got much longer to go. I don't think. Hang on, I'm coming. Ah.
Really caused by blunt force trauma.
Right. And the hematoma and the laceration were
Oh,
right next
you
to
put
each
that
other,
up the
correct?
same time as
Yes.
me.
Okay. And you indicated last year, or let me ask you this way.
Yes, it
Is
is.
that consistent or inconsistent with a
Sorry.
physical altercation?
Objection.
Can you
Oh,
answer that?
thank
I
you,
could not
Jack.
say, Your Honor.
Okay, next question.
Well, last year, you indicate you can't answer that. Last year, you did answer it, didn't you?
Objection.
So I need to see counsel at sidebar for just a minute, please.
What was the question he was asking? What did he answer last year that
I have no idea.
you weren't listening? I found a picture of what they were talking about. So that's John's eyes. And they were talking about him having the bruising above eyes, and this is his forearm. And there is another one I've got of the full arm. I sold it in, I was very last time we streamed and I couldn't find anything. So I actually went right through all of these files and named them individually. And then I put one folder that says really important ones for second trial. Because when I get tired, I can see it, but I can't comprehend it. It's like I'm looking at it, but no one's home. And nothing will it'll just go. "Oh." So I thought I would be really organized. And there was one that I wanted to show that compared similar injuries to John's. Okay. All right. It's a PNG copy. I'm not going to be able to use that or not. Present image. Oh, they're letting me. Woo! All right, so that is his the whole right arm, and there we go. Oops. You have to present it first, Jodie. They've changed this set out, haven't they?
Yep, they're back.
Okay. Go on. I'll have it set up ready for next time.
After the luncheon break. So this is
Sounds good.
the luncheon break. There's lunch.
Yeah, they're going to lunch.
Oh, but come back.
Tony, is it here? Okay. There's lunch here for you. We'll see you in about a half an hour.
All rise, please.
They go to lunch.
Yeah. I found some. You know the wounds that they were saying were defensive wounds on the back of his hands? IV. They were trying to get IV access. That's a close-up of his right hand. You can see the punch marks. And that's not where you punch people. You punch people on the knuckles. Unless you're flicking away a snake. You might get that. And I found some comparisons of bite marks as well. Take that over there so that you can see it a bit better. I forgot I had these. I did all these last year. What the fuck's the overlay? Must be up the top. Yeah. Okay. We make a smaller. That one. No, that one. Yeah, so top left one's John, and the rest are dog bites.
And they're not similar.
Depends if you're pulling away or not.
None
You
of
won't-
those bites are similar to the injuries he has.
You are not going to get identical dog bite wounds.
They're not even saying identical. They're not even close to looking the same.
Mm-hmm. All right, let's have a look at the comparison between sharp force injuries then and John's arms. When I find where I put them. Yeah, there we go. Number 11. Sent. Oopsie. Get out there. Present. Image. Why is it taking so long? Okay, it's a sub-folder. There it is. $11. Thank you. There we go. So that bottom left one, that's what you would get if you if you've been hit by something like triangle, like a pointy. Yeah, because it digs in. And the white one is with knives, tools, and machinery. Deeper laceration. Because they're fairly superficial.
That's why I reckon those are more likely due to bolts and protruding metal from the undercarriage.
But if you see, like, obviously these, the ones to like, I'm going to explain it. So the ones that I've chosen, they may have just like stood still and the dog has just punctured the skin. Whereas the one up with John, either the dog or him could have been pulling backwards and the teeth have dragged, causing those.
There are almost no animal bite wounds where the person stands still where the animal is biting them,
Yeah.
because it's just your natural
Human
thing of
nature.
that hurts. It's a
It's a
way.
response. Yep. It's a response. Yep. It also depends on the strength of the dog's jaw, how good a grip they've got on you, how deep the teeth are in, a whole gamut of things. That's why they're unreliable in testimony. What's that you've got?
Oh, that's just the continuing broadcast.
Oh, is it? Is that
It's
an
just
ad?
what Law and Crime are doing whilst the lunch break is on.
I've got Jesse Weber on. Oh, they're going through the Albert family tree.
Pointless.
Oh, bloody cats. Yikes.
And there is, of course, the blatant flaw in the dog bite argument.
Pardon?
There is no possible way, without washing the body in bleach, that they would not find dog DNA in the wounds.
They
It is
tested
just an
the clothing.
impossibility.
They tested the clothing, not the skin. That's what. Excuse me. Why have they got this on? Why have I got a different feed than you?
Apparently.
In the group text saying, tell the cops John didn't
Right.
go in the house. That's, there's sort of two different analyses.
Can I just pick up on something that you said? What you
Oh, this is
anticipate
Jesse
the
Weber's.
prosecution's argument will be or has been regarding why they would have gotten rid of their phones? What's I don't know if it's an innocent explanation, but what's an alternative explanation other than trying to get rid of evidence for allegedly being involved in what happened to John O'Keefe?
Well, I think it's interesting to understand the backstory, and that the difficult part about this information, if you're the Commonwealth and how you want to try to explain it away, is
You want your proctor?
I think what their likely argument would be is at this point in time, the pretrial litigation, Karen Reed had been charged with the death of John O'Keefe, and it wasn't until much later that this third-party culprit theory sort of came into play in the legal context until it started being mentioned in court. And shortly thereafter, the case really exploded locally in the media. There was quite a bit of coverage, quite a bit of vitriol. At that point, Colin Albert, Brian Higgins were publicly being named as potential murder suspects. And, I think the reality in some ways from the Commonwealth's perspective is maybe they got rid of their phones because they knew whatever was on there was not going to be helpful. When we have the text messages that were taken from Michael Proctor's phone and, have caused quite a significant
it is plausible if you
consequence
leave a
to
scene
his,
unsecured and
his
don't search for
personal life,
anything.
his professional life. And these are two police officers who, I think there's probably a likelihood that there was some stuff on that phone that they didn't want anybody seeing, whether that is specific to this case or if it's other things that the police and the defense would have found. But it's hard for the Commonwealth to get into that without really opening the door into sort of the secondary issue in this case, which is the public pressure and sort of, what they would allege is harassment campaign of the witnesses.
By the way, that in and of itself, you couple that with the testimony of Trooper Proctor, former Trooper Proctor, it doesn't look good. It really doesn't look good. And those optics is great for an argument of reasonable doubt, which, by the way, brings me to another question. This is from Ryla Terra. Why is the Commonwealth pursuing this with the conflicting evidence? Are they trying to make an example out of her, meaning Karen Read, and save face? What do you think?
I genuinely believe that they think she committed this crime. I think that from their perspective, their review of the evidence, they think that they can convict her. And, you know, it's a question I've had for a long time relative to the level of charging for Karen Read. You know, the manslaughter, I think, is one that they likely, you know, could potentially get a conviction on. The second-degree murder has always seemed to be a stretch. But I don't think that this is a case in which they're trying to make an example of her. I think that ultimately the Commonwealth's job is to seek justice, and they believe that justice means Karen Read being held responsible for what they believe she did, which was kill John O'Keefe. So while I understand the
using taxpayer-funded money to buy
sort of questioning why they are moving forward with this case, I do believe it's because they ultimately believe she's responsible.
No, I agree. And look, you talk to anybody
I found
about this case from anywhere across the country. People have opinions. There's no real gray area. It's I either think she did it, I either think she did it either intentionally or it's a cover-up. I mean, there's no like.
There's no gray.
There's no gray. Now, you could have a hung jury. Okay, let me ask you this. We have another question, and I'll be completely honest. The way this is spelled, I'm not exactly sure how to pronounce it. The letters are very interesting. I'm going to go with Taryn. I apologize if I mispronounce it. Taryn. If O'Keefe's hematoma was located on the right side of his face, could this injury have been done by someone that is left-handed?
That's a good question. I am not a medical doctor, so I don't know.
Right side of his face,
that's
left-handed.
One of those questions that really seems to be probably more common sense.
But that's not a punch.
Really what goes to what a jury is made up of, right? We're asking people not only to pay attention to the evidence presented before you and the individual witnesses and experts interpreting.
Have you ever been punched in the eye and had it look like that? With blood pooled in your eyelid?
No.
You get your split eyebrow and your black eye underneath, yeah?
Yeah, I've had the split eyebrow.
Yeah, because there's no fatty tissue. That's where the bone meets, and it's easy. That's where you contact, and you get. Let me move this back up.
There's also the thing of, you know, people's hands are bigger than your eye.
Yeah, but there's no cushioning underneath it. So if it's got a split, that's where it'll split. And if you're hitting someone,
either that or it'll split on the ocular bone underneath.
Yep. So you're hitting with this part of your hand, not this bit, not that bit, this bit. That's where you're punching from. So if you're going to have a punch wound, that's where your damage will be, not on the top.
Yeah.
So
I mean, the only time the back of your hand is good to have anything is when you are literally doing a backhand.
Yeah. Yep.
Or a bitch slap, depending on which way you want to call it.
A swipe away. But if you've got two puncture wounds there,
that's going to be from IVs.
Yeah, exactly. Oh, fuck. Nothing to see here.
We all know that Jodie has definitely hit someone before.
Punched someone.
Yeah. She's Australian. There isn't an Australian on the planet who hasn't punched somebody.
And they deserved it. It was my husband, actually. He threw a dead spider at me.
Domestic abuse.
I had no control. It was carnal. I had no control. He never did it again, though. Amazing how much strength you can summon when you need to. It's the same as like when I got home from hospital here, and after I discovered that the fucking crack whores out the front had robbed me and taken all my fucking food. Yeah. I just got home from hospital and I went banshee. Absolutely fucking banshee.
That adrenaline drop will.
Well, the thing that I live in the start again. I am the rear unit of 2. There is one way in and one way out to my place, and that's past them. My driveway runs down the side, so you go to my carport past their front door, and there is no exit out the back. It's my garden sort of does a full U-turn. I've got a laundry door and a dining room door, and it's just a full circle. You can't get out the back, so there's no escape for me. Which is why I'm able to do this AVO. But out the front of their place, they're druggos, they've got like supermarket trolleys full of junk and shit and just garbage bags full of bits and pieces. There's even like 5-litre containers of poison or some chemicals and shit. And I thought, I am not going to sit in that unit at the back there and quiver like a fucking little girl and be a sitting duck for these bitches. Nuh-uh, sorry. So I had to draw the line. I had to put them back in the pecking order. And I did. So the second I get out of the cab, and they did not even come outside. I was throwing that fucking trolley, everything. Yes. Yeah. It was. They won't be doing it again. They don't like having to mop up their toilet and bathroom every time I water my garden. Or the hot chili sauce I put on their rubbish bin handles, like really, 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 really hot. like, oh my God, hot. You ask Tanya. It's like, oh, for fuck's sake, don't know. I can't even look at it. My mother went into labour with me with a spider fright. She was in the shower and a huntsman come down the shower and she screamed and her water broke. I shit you not. It's innate with me. No, I can't even. Oh, for fuck's sake, I can't even look at it at the bottom of the screen. I can't. Yeah, so what he had done, he had killed this huntsman, and he then had to pick up all the legs and the guts and the bits and pieces with a dustpan and brush. And he flicked the contents of that dustpan and brush at me. I did it once. I had no control. It was... It's fucking funny, actually.
It is.
Tanya! Right, that's it. Time out. Where's my avatar? Actually, I should show you some of the ones that she's done. She's so clever. Where are we? They're on canvas still. I saved a couple as background. That's all I had time for today. And who is the dickhead that put fucking stickers on plums? Do you know how fucking hard that is to get off when you've got rheumatoid arthritis in your fucking hands? I sobbed for about 10 minutes this morning, and then I started throwing shit. Do you get that cut off? So the skin came as well. Fuck yous. Fuck yous all. He hasn't finished his cross-examination, has he?
I don't think so, no.
Okay, there's no point me downloading the I must be getting tired. I'm clicking into the wrong shit. What's the time? 3:30. Woohoo!
Only about another 4 hours to go.
Fucking hell. So what time are they coming back?
I think she said about half an hour or so.
What's the time now? So they went at what? About 1:15.
Yeah, they weren't having a long break this time.
Wonder how many witnesses they'll get through. Does anyone know where to get the witness list from?
Nope. Not a clue.
Anyone in chat?
Haven't looked.
We've got some smarties in chat, surely. What? What am I sharing? No, that's you. No, that's me. Stop that. I want this. Share screen. Yeah, they've changed. StreamYard have changed their format. And there's something else they've added that I can't find.
I know,
anymore.
it's just not as good as it used to be.
It doesn't flow as easily. You get clicked into this and that, and
Yep.
where you thought you used to be, it's not there anymore. It's like, what the fuck?
And things that used to take you 1 click now take you 3.
Yeah. All right, so these are how do I make it bigger? There we go. So we have Yannetti, Alessi, Little, Jackson, and Karen. Morrissey, Tully, Bukaki, and Proctor. They're good, aren't they? Oh, that's them again. I'm going to take the background. I said you've got to make this one way, way, way more ugly. Nicole, Julie. I haven't downloaded this one yet. Special Prosecutor Hank Brennan, a.k.a. Special Prosecutor Brennan, a waste of taxpayer money, an award-winning dipshit, or a whiny little bitch. Chloe. Lali. Good one, Lali. The Arcas. Jackson. I like this one. Who's that? And this one of Kerry Roberts is really good too. And Lucky, look at that. Fit an image. And Tanya. She looks exactly like that too. Spot on. I love Canva. What do you click? I can hear you. Clickety clacking.
I'm not doing anything.
Uh-huh. Bollocks. You're too quiet. You're up to something. I know
This
you.
is the best thing on YouTube. Far better than my child exploding shit I put out. Really enjoying this trial. Thank you. The defense. Reyes and WNN.
The inflection on the fans. Rest. You know what we should do? We should do a Suno song, an AI song. Make one up.
Possible.
Yeah. Unless anyone's got any questions they want to ask the blah, 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 you know, the computer me Bob. What's Steve up to? Is he streaming? Are you watching Law and Crime, or am I supposed to be?
Well, it's backstage. It's just there playing in the little.
So that's you. My mum, you know what we need for tomorrow? We need to organise like a poker game or something. Something to do in the lunch break. Because that's what I find the hardest, is trying to fill that hour. I suppose we could always put like avatars up and come back at 1. Just keep it running. What was I looking up? I can't even remember. Do you remember what I was looking up? Okay.
Not a clue.
You weren't listening either. Had something. What were we talking about before that? Oh, no, lost it again. Oh, I'm tired. Oh, do you want to put your song on?
Can do. Hang on. Gives us both a couple of minutes break.
I don't know you, but I hate your guts. I don't love you, but you can kiss my butt. I knew your wife when she was just a slut. I'm a badass son of a you-know-what. A keyboard cowboy, a hashtag threat. Everybody's brave on the internet. When my thumbs get to typing, I get balls of brass. I'm down for anything, you gotta stick up your ass. I'm the reason guys like you will always finish last. Your mama didn't give birth to you, she just blew you out her ass. I'm a keyboard cowboy, I'm a hashtag threat. Everybody brave on the internet. Long on snark, short on shame, hiding behind my anonymous name. I'm the scum of the earth, I'm the shit on your shoe. Me and my followers are following you. Well, I'm a vicious roamer, I'm a bald-faced lie. I'm a tweet my daily twaddle with a twinkle in my eye. Don't you just love to watch a baby cry? Cross my heart and hope you die. I'm a keyboard cowboy, a hashtag threat. Everybody's brave on the internet. long on snark, short on shame, hiding behind my anonymous name. I'm the scum of the earth, I'm the shit on your shoe. Me and my followers are following you. Well, I hit where it hurts, I cut to the chase. I lob grenades from an undisclosed place, but when the tough get going, I run and hide, 'cause God forbid I gotta take it outside. I'm a keyboard cowboy, hashtag threat. Everybody's brave on the internet.
I like that song.
True. Fucking true. I know what I was doing. I was looking to see what Steve was doing.
Oh, you were stalking somebody.
I need to see, because he popped in before and then popped off again. He was supposed to ring me last night, but it was his wife's birthday. Oh, I know a good one, but you can't do it on here, I don't think. No, you can't. With the girls when I'm on Discord, I I get a GIF and you have to type in 2 words in the search, and whatever comes up in that search you can pick from whatever, and then everyone else has to get what 2 words you picked from the GIF that you get. It's bloody funny. You type in eat dick. Oh, we should have another Temu. Another Temu binge. That was funny. That was really funny. I had a stream where I was trying to get subscribers. I think it was, I just gotten to the 500 mark, so I was able to do super streams and super stickers and super chats. And so I said, all right, well, for every $5 super chats, I would do a shot of a cocksucking cowboy. And for every $40 I received, we would go into my Temu account and the chat could choose what search we used and then choose, they can make the decision and spend $10 on my Temu account. And the shit that we found, that's how I got that hat. There's my yeast infection itches. And I got a wind sheeter that says it's got like half of it is covered in blood stains and the other half is clean. And it says game over or problem solved. Problem solved. There was some funny shit. You can buy a lot for $10 on Temu. $27. Sleuthy Goosey. All right. Sleuthy Goosey is effing awesome. She is the lady that does the huge, intricate timelines, and she links every single document, every single file, every single media. Like, if her timeline states Jennifer McCabe rings blah blah blah, she will put the exhibit number in there, and you can actually click into it and go to that exhibit. She's awesome. What's Ian up to? Is Tricia still in chat? Yeah. Yeah, it was funny as, wasn't it? I've reached out to KC1 at least 3 or 4 times, and I've not had any response whatsoever. I don't know. Don't know what's going on there, love. Yeah. Our uncle's doing recaps. Okay. Because he works full time, I think, too, doesn't he? Oh, that's what I was telling you earlier. How Brian and I met. We recovery addict.
Fair enough.
And he only just had his phone thing connected to his computer. And he said, all right, you know, those people that have got, you know, a microphone and audio set up, you can call this number and I'll let you off on stage for a bit. And this is like, I was laying in bed, 2 o'clock in the morning, and I jumped out of bed. I only just started the channel. Basically, hadn't even finished the logo, I don't even think. And he and Brian and I actually got up at the same time. There was like 4 of us, I think, and we were talking about the trial and what have you. And yeah, from then on, we sort of kept in touch because he wanted to do a similar thing as me, and then we thought that we could, you know, stream a bit together here and there, and blah blah blah. And then he went back to work full time, and then he got a second job, so he couldn't do it, which is a bugger. But he, you know, come and stream on me every so often when he had days off, and but he works way too hard. Poor bugger. He's a what do they call him over there? Respiratory. Call him something different here. But he works in intensive care and in the NICU, but mainly to do with airways and breathing. How about I put on...
I'm going to pause here and say, well, yes, you fucking rock the defense rests.
Yes, I do. How about this one? Oh. Yeah.
People want you to go on another Temu expedition? Oh, God.
Hey? It was so much fun. It was so much fun. We can do that. How about we do that tomorrow? He is lovely. He is lovely. But if you look at us 12 months ago, completely different. Completely different. And he was in the Navy, I think, too, wasn't he? I do believe. Oh, look, has everyone checked out? Oh, wrong one. I just clicked on the Tanya Hill's YouTube channel, not After the Facts. Got 5 subscribers, 10.
Woohoo!
Yeah. It's like it's a private one she doesn't use. All right, so Live. All right, he must have only just been putting up videos that he'd pre-recorded because. Oh no, this stuff from yesterday. What day is the Laurie Daybell trial up to?
No idea.
She's actually just been convicted, but how many days did that take? That doctor that supposedly offed his wife, well, he got found guilty of it, didn't he? He is ugly. Oh my God.
Well, ugly people can murder as well.
He's as ugly as a hat full of assholes.
That's one ugly hat.
Yeah. See, he's posting in his community posts videos. Has the Jose Morales trial finished?
Not a clue. I must admit, I've not been following many lately.
That trial is a pain in the ass because I saw it because it's based in Connecticut, and I did it purely because Bry's in Connecticut, and so I'd followed this trial and I'd done all of the graphics and the artwork and the thumbnails and the bloody overlays and all the rest of it, and I'd done the summary and the little promo video and put it all up. And the day I went to run it, I checked on Discord and it had been postponed for some reason. So then I had it done again and had it set up for that new date, and no one was streaming it. What the fuck? Twice. So it was when the day I got home from hospital, I've opened up YouTube, and the first thing I saw, day one of this fucking trial. I'm like, you bastards. So I have been saving them, and I'll run it after at some time. Maybe next year. The way we're going with this trial.
You might not want to do another trial after this one, ever.
Well, that'll take us through the end of the year. Did you watch any of that at the start?
No.
Oh, that was really, really interesting. Like, I was absolutely. Oh, okay, cool, good job. What about the daughter? Any news on her? Is it Vanessa, the little one? Yeah, I watched it when it first happened. And as the investigation, that was pretty much one of the main trials that convinced me to start a channel. And the next one was Take Care of Maya. After I watched that, it was awesome. You seen that one?
No, I don't think I did.
That was a really, really big one. Went for, I think, 8 weeks at least. And that was the one where the hospital took possession of the child and accused the mother of Munchausen's by proxy, and the mother ended up unaliving herself. Court's back, Dan.
Yep.
May I, Your Honor?
Yes, please.
Firefighter Nuttall, over the lunch hour, did you discuss anything that we had discussed this morning or earlier in the session with anybody about your testimony?
No, sir.
You did mention earlier today the EMTs that were with you that responded to the scene. You mentioned, I think you said Anthony Flamati,
Yes,
correct?
Yes, sir.
You mentioned Kelly, and I want to say Matt Kelly. Matt Kelly?
Yep.
Yourself?
Correct.
And of the three of you, two of the three of you were and are paramedics, firefighter Flamati and yourself, correct?
Correct.
Do you know the name Katie McLaughlin?
I do.
Who is Katie McLaughlin?
She is a firefighter paramedic for the town of Canton.
Was she also on the call?
She was.
You didn't mention her this morning.
It did not come up. She responded on the initial dispatch on engine 3.
You were asked who responded with you, correct?
Yes, sir.
I do, yes,
And you
I
mentioned
do.
yourself. You mentioned Tony Flamati. You mentioned Matt Kelly.
Yes, myself, firefighter Flamati, and firefighter Kelly responded in ambulance 1 together.
Okay. And how did firefighter McLaughlin respond?
So she was assigned to engine 3 that night. She was with Lieutenant Woodbury and firefighter paramedic Frank Walsh.
Is she also, in addition to Walsh being, it's Frank Walsh?
Yes, sir.
In addition to firefighter Walsh being a paramedic, Katie McLaughlin was also a paramedic.
Correct.
So she responded to the scene at the same time as you, generally, but in a different ambulance.
In a fire truck, in a piece of fire apparatus. She was in engine 3.
Got it. Engine 3. Okay. And she was with you, generally, when I say with you, at the scene during the entire time that you're describing the events that you described with Mr. Brennan on direct examination?
For the most part.
Okay. She then left in a particular ambulance, correct?
Yes, she ended up driving ambulance 1 to Good Samaritan.
And ambulance 1 was which ambulance?
Ambulance 1 was the initial ambulance that myself, firefighter Kelly, and firefighter Flamati responded in.
So right after the scene you described, as you're leaving the scene, firefighter McLaughlin is in the ambulance with you and firefighter Flamati, correct?
She is driving. So the 3 of us are in the back in the patient compartment. She is up front in the driver's seat.
Once at the hospital, did firefighter McLaughlin go into the hospital with the other firefighters?
I believe so, yes.
So she was with you in the engine. She was, although in the driving cab, she was with you, ambulance in the driving cab. She was also with you right after the scene at the hospital, correct?
Yes, sir.
And she was also with you later after you cleared the hospital and went back to the station.
Yes, sir.
You had discussions with firefighter Flamati about the incident. That would be normal protocol.
Correct.
Almost like a debrief.
Sure.
You had the same types of discussions with firefighter Kelly, Matt Kelly.
Yes, sir.
I'm guessing that you probably had the same sorts of discussions with firefighter Walsh.
I actually don't know if I saw firefighter Walsh when we got back. The weather was right at shift change, and the weather getting back was also getting worse. So I honestly couldn't speak to that.
And you also had conversations with firefighter McLaughlin after you cleared the hospital and got back to the station as well.
She was part of the debrief. Yes, sir.
Okay. And all of you discussed what you did, saw, and heard, generally speaking, while at the scene, correct?
Those are more in terms of getting equipment wrangled, really kind of how they go. What did we use? What do we need? What are we going to have to restock when we get back?
Right. But there also was obviously discussions about what had just happened. I mean, you are dealing with a dead or dying police officer on a lawn, on a snow-covered lawn in a cold environment.
I honestly couldn't speak to that, sir. I honestly don't remember.
It's because you don't remember, correct?
Well, like I said, it's mostly those debriefs are usually, they're very
Bad pause.
Equipment, make sure that the ambulance is ready for the next call, etc. I'm asking about a general debrief with the fellow firefighters, male and female, that you were with at that scene. You're telling me that you don't remember debriefing and discussing the incident and your observations at the incident following that incident?
No, sir.
Okay. But your memory, you indicated earlier, gets better with time, right?
Yes, sir.
You don't remember it as you sit here today?
Ask the question again.
Sure. Do you remember discussing with firefighter Flamati, firefighter Walsh, firefighter Kelly, firefighter McLaughlin, any of them, your observations and what happened while at the scene after you cleared the hospital and got back to the station?
No, sir.
Have no memory of that whatsoever?
No, sir.
When we left off before lunch, I was asking you about a hematoma and a laceration over the right eye of Mr. O'Keefe. Do you recall that?
Yes, sir.
I asked you, is being punched in the face, can that lead to a small laceration like you saw and a hematoma like you saw?
Objection.
I'm going to allow it.
I couldn't speak to how that injury occurred.
Is it consistent? Are those injuries, just those injuries, are those consistent with being punched in the face?
Those injuries could be sustained from numerous ways.
And
yes, it could be from that. It could be from others as well.
Okay, so that's what I'm asking you. It could be. In other words, it's consistent
Yes,
with
sir.
being punched in the face, correct? Correct. Thank you. I want to ask you about this statement that you indicate that you heard that now is 3 statements, 3 phrases, correct?
Yes, sir.
When you heard this statement, describe for me exactly where you were. What were you doing and who was around you?
I was knelt at the head of John O'Keefe with a bag valve mask, delivering ventilations. Firefighter Kelly was to the right, and firefighter Flamati was on the left side of Mr. O'Keefe, and the 3 of us together were working to perform CPR and ventilations.
And your job, and I hate to butcher it, but you'll correct me.
Yes, sir.
Your job was to do the airway, correct?
Yes, sir.
And I'm picturing a big balloon-like apparatus that you put over the patient's mouth. And
Exactly.
squeeze it.
Yes.
That's as opposed to, it's an advancement on just mouth-to-mouth resuscitation, correct?
Correct. Yeah.
You were the airway person doing the squeezing of the bag.
Correct.
What was Tony Flamati, firefighter Flamati, doing?
He was starting CPR, in which that point was taken over by firefighter Kelly.
Okay. So firefighter Flamati, when you say starting CPR, describe what that means. What is the physical act of CPR?
So you put both hands together like this, one on top of the other. You put it right on top of the sternum, and you begin doing chest compressions 2 inches deep, allowing full recoil for 100 to 120 beats per minute, compressions a minute to sustain a cardiac rhythm. You're manually making the heart beat with each compression.
Which means that is a rhythmic pumping motion, correct?
Yes, sir.
So if you see someone doing CPR, you're probably going to see their shoulders moving up and down and moving rhythmically, correct?
Correct.
Do you remember what firefighter Flamati was wearing? You had just come off of actually you were just coming onto a shift, so you didn't have all your foul weather gear officially, correct?
I had my puffy jacket. Okay. I had my Canton Fire jacket.
Got it. Firefighter Flamati, on the other hand, had a bright yellow jacket.
Correct.
Sort of reflective and a safety jacket.
Yes, sir.
And he was kneeling to your left at the time doing, have I got that right?
Yeah, no, yep, you got that right.
Okay, he's kneeling to your left at the time doing chest compressions. That's when you indicate that Miss Reed walked over and made the statement.
Correct.
And Kelly was there as well?
Yes, sir.
Kneeling right beside all 3 of you as firefighter Flamati was giving the chest compressions, correct?
Yes, sir.
Okay. You indicated that the statement was in response to a question that you asked of my client. Do you know him?
Yes, sir.
Is that right?
Correct.
And she responded to you with the phrase that you've used. I hit him.
I hit him. I hit him. I hit him.
Right. So it's absolutely clear in your mind when that statement was made, you were knelt down over Mr. O'Keefe. Firefighter Flamati was doing the CPR, and Kelly was with the both of you when you posed that question.
Yes, sir.
It's a very detailed memory.
Yes, sir.
You indicated, Mr. Brennan, that sticks out in your mind. Is that right?
It does.
But that's not at all what you told Trooper Proctor on February 8th, just 10 days after this incident, is it?
I don't recall what I told Trooper Proctor.
I thought your memory got better with time.
I don't recall that meeting.
Okay.
I recall meeting with him, but I don't recall the extent of what was discussed.
You literally don't in that meeting in that formal interview with the lead detective on this case.
We discussed the case, but I don't, and in his words, I'm not sure what he put down.
What you said to Trooper Proctor on February 8th, 10 days after this, was you overheard Miss Reed say, I hit him one time to another female that she was talking to. Correct?
Objection.
No, I'll allow it. Did you say that?
I have no memory of this, Your Honor.
Okay, next question.
Did you say that her statement was an answer to a question posed by the female or a discussion with the female?
Break that down for me, sir.
Sure. Did you tell Trooper Proctor on February 8th that what you heard was Karen Reed speaking to a female, not answering a question that you posed?
Again, I don't recall that specific question.
I think this is another mistake from the defense. They're now kind of implying that they can rely on Proctor's testimony about what this guy said to Proctor.
No, they're just trying to impeach him.
Completely discredited.
They're just trying to impeach him on his prior inconsistent statements. That's all.
Yeah, but they're bringing in what Proctor has said about it, which is not a good idea.
It was his interview with Trooper Proctor on the 8th of February. So
yeah, but the only record of that is what Trooper Proctor wrote down. It's not an audio recorded interview. It's not a video recorded interview. It's just Proctor's notes.
Yeah, but I've got the testimony of that, of Nuttall's version of what happened on that interview in his last testimony.
I suppose they could be doing that, but there's not a huge amount, I suppose, but seems to me a bit risky to bring in Proctor's evidence.
No, it's not. It's from Timothy's direct testimony in the last trial.
Yeah, but that's not what they're quoting. They're quoting what Proctor has said, not what he said in the last trial.
Was that the question posed, or I thought they were asking him what he said to Proctor?
They're asking him what he said to Proctor, but the only way they have anything that he said to Proctor is Proctor's notes. And that's where I think it's a bit iffy, because everything Proctor touched is, they're going to argue, is discredited. So on the one hand, they're using it here to try and discredit this witness, but then they're going to discredit all of Proctor's other stuff, except for this one little bit.
Well, in my opinion, they've already discredited Proctor because he's been disqualified, and they're just trying to.
Yeah, but that discreditation hasn't happened to the jury yet, remember?
Yeah, they announced it in opening statements.
Yeah, but they didn't say why he'd been sacked or go into all the details, just that he was sacked. they're going to have it that the jury is faced with, they have to believe Proctor lied about everything except for what this one thing, or he didn't lie. They're making it harder for that own thing to portray Proctor has set this up.
Did you tell Trooper Proctor on February 8th while you were rendering aid, and at the time you heard the statement, Miss Reed was actually praying over John? Your words, praying over John.
I don't recall ever saying that.
May I have just a moment, Your Honor?
Yes.
Did you say that you observed Karen Reed to have blood on her face from providing mouth-to-mouth breaths to Mr. O'Keefe prior to your arrival?
I remember Miss Reed having blood on her face, presumably from attempting CPR.
Do you remember telling Trooper Proctor on February 8th that you saw her with blood on her face from CPR?
I do.
So you remember that portion of your conversation with Trooper Proctor, correct?
Yes, sir.
But the praying over John, praying over the victim, you don't remember.
I don't remember ever saying that. Ever.
And the statement, I hit him to another female, you also don't remember that.
No, sir.
Would it refresh your recollection if you were to look at a report
Yes, sir.
offered by Trooper Proctor? May I?
Yes.
May I direct the witness's attention to the second page, Your Honor?
All right. Why don't you take a look at that? Sir?
So in his grand jury testimony, he said that he overheard the person say it to the female, and now he's saying that Karen directly spoke to him. It's like it's changed. The version's changed every time.
May I approach, Your Honor?
Yes. Thank you.
Now, you see, if the defense said it like you just did, that would work, but they're not. They're using Proctor's statements and Proctor's report.
Yeah, this is in his interview with Proctor.
Yeah. Instead of referencing his statement to the grand jury, they're referencing the statement to Proctor, where the only evidence is what Proctor wrote.
Yeah, this compares the two. Well,
but they're not. You are, but the defense isn't. They're solely using Proctor's notes. They're not even saying, well, in the last trial you said this. They're not saying in your statement to the grand jury you said this. They're literally using Proctor's notes.
It offers you at the end, once you've asked your question, it's listed the discrepancies and then what the prosecution did and asked on redirect.
Yeah, but you see, the way you're doing it makes sense. The way the defense doing it doesn't. Why the defense isn't saying, but in the grand jury you said that you overheard it.
His last testimony, he had memory issues, and he said when confronted with these, he admitted that I don't fully recall that meeting with Mr. Proctor. I remember meeting with him, however, I don't fully remember what was discussed. And when asked if his memory was a little bit faulty regarding that time frame, he responded absolutely.
Yeah, which is all they're going to get out of him this time. But if they used what he said to the grand jury, it gives them a much better one.
Yeah. Because
they can literally pull up the record from the grand jury and go, well, there's your testimony to the grand jury, which is different from what you're saying now.
Can you get transcripts from the grand jury?
I would imagine they have copies of his testimony to the grand jury. Yeah, it would be part of disclosure, wouldn't it?
Can I get copies of it?
I don't know if you can.
That would be interesting, wouldn't it? Having three testimonies to compare.
Sir, did you have an opportunity to glance at the report that you were just shown?
Yes, sir.
Does that refresh your recollection about your conversation with Trooper Proctor that he put in a report?
It does not, sir.
So as you sit here, you have no memory of what you just read in this report from Trooper Proctor, the lead investigator on the case.
I have no recollection of ever saying that anybody prayed over anybody ever in this case.
That didn't come up in this either.
You did see it in his report, though.
I didn't.
Sustain.
You've admitted under oath that your memory of the events at that time, from that time frame, January, February 2022, is faulty, correct?
No, sir.
It's even using the same terms as me.
In your April 2024, it's April 30th, 2024 testimony from last year. You were asked whether or not your memory was a little faulty, and your answer was absolutely, correct?
Could I have a page and number,
Where is
please?
that, Mr. Jackson?
Volume
Let me
8,
show you, shall I?
page 151, lines 14 through 16.
Can you read the lines again?
Lines 14 through 16. I'll just allow counsel to get that up.
If we could pose the entire question and give content to it, please.
Okay.
May I?
Yeah, so do you intend to show the whole question?
The whole question that I asked and his answer, yes.
All right, and I'll give you the opportunity. I'll redirect Mr. Brennan if it's not. Go ahead.
Is it true that in answer to the question, quote, so it's fair to say your memory is a little bit faulty as it pertains to that time frame? Your answer was absolutely. Correct?
From last year?
What you testified to last year about conversations that you had with Trooper Proctor around February 8th of 2022.
Yes, sir.
And you would agree, as you sit here, that your memory is still faulty about your conversation with him,
With
correct?
Trooper Proctor? Yes, sir.
So you're not saying you didn't say that the statement was made to a woman, correct?
Objection.
Are you saying that?
No, ma'am.
Okay, next question.
Thank you. And you're also not saying that you didn't say to Trooper Proctor that you saw Karen Reed praying over John O'Keefe.
Objection.
So I'd like you to ask that differently. Did you say that?
I have no recollection of saying that ever.
Okay. Next question.
My point is, if you have no recollection of it, you're not denying saying it.
Objection.
Are you denying saying it?
Yes.
So you do have a recollection that you never said it. Do you understand the difference?
Oh, sir, I don't believe I've ever said praying. That's really not something that I would have said. I didn't see it that day. It didn't happen. I don't remember ever saying prayed
You didn't
in regards
see
to
it
this case ever.
You didn't see it that day, and it never happened. That was your words just now, correct?
Break that down for me.
You didn't see it that day, and it never happened. That's what you're saying about the praying statement, correct?
Yes, sir.
And in that same exact statement, you also included the phrase, I hit him, correct?
No, sir.
In the statement that you made to Trooper Proctor,
The report that Trooper Proctor wrote?
correct?
Again, I don't remember ever saying the words praying over him. I do distinctly remember I hit him.
Which doesn't appear in that report, does it?
Objection.
I'm going to sustain that, Mr. Jackson. You directed him only to page 2.
Understood, Your Honor. I'd like to show you a short portion of a video, the same video that you were asked to look at on direct examination. And Your Honor, I pray to the court, I can certainly mark it as a defense exhibit or for
So is this
identification?
going to be an exhibit by agreement?
It is.
It
Okay,
is.
So we now that, Madam Court Reporter, thank you.
I have spent a lot of time on this trial, I must say. A lot.
Thank you, Your Honor. With the court's permission, may I play a portion of that video for the jurors, publish it?
Okay. Which portion, so people know?
I'm going to start it at about, I want to say 6:55. Mr. Wall, could cue that up? Before you play it, can we have it on that screen as well, or is it only playing to this screen?
I don't know. When Ms. Gilman did it, it was both. Great.
There we go. All right. Before we play it, can I ask you a quick question about this?
Sure.
It appears that this is paused. Do you recognize this as being the same video that you were shown this morning by Mr. Brennan?
I do.
All right. Describe the scene.
So that is 34 Fairview Road. The lights in the background, I believe it is either right as we pulled up or right as we're pulling up.
Okay. Same dash cam video.
Yes, sir.
Can we scroll this to the 6:55 runtime spot, please? Pause it. Okay. Do you see the individual on the left? Far left.
Yeah, the jacket?
Correct.
Yes, sir.
Who's that?
I believe that's firefighter Flamati.
You previously indicated that firefighter Flamati was on his knees providing CPR at the same time you were knelt down providing the airway.
This isn't when it was
That's
stated.
not my question. Is that what you said?
Can you repeat the question, please?
Sure. You indicated earlier when you heard this statement by my client, you were very detailed. Firefighter Flamati was knelt down providing chest compressions at the same time you were knelt down providing airway support for Mr. O'Keefe, correct?
I had also said that at some point,
That's a
firefighter
yes or no
Flamati
question.
had
Objection.
So I'm going to let the witness answer the question.
transferred CPR to firefighter Kelly. Firefighter Kelly did take over compressions at one point.
Okay. That's not my question.
Not what you
My
said,
question's
though.
an easy one. Did you say that when Miss Reed walked over to you and you had this dialogue with her, she made that statement that firefighter Flamati was on his knees providing chest compressions at the same time you were knelt down providing airway support?
Yes, sir.
Okay. Firefighter Flamati, in your testimony, appears to be standing up right there, correct?
Yes, sir.
Let's play the video forward for just a second. Stop it. What did you see firefighter Flamati do just now?
I believe he just knelt down.
Okay. So at this point, he's kneeling for the first time, correct?
Yes, Darren.
Yes, sir.
And he's about to provide chest compressions as your memory serves, correct?
Yes, sir.
All right. Let's go ahead and play it forward. Pause. Did you see my client in that photo? I'm sorry, in that clip?
No, sir.
You didn't see her?
Oh, no, I did see her. Yeah. I don't see her on right now.
Right. She just walked off frame, correct?
Yes, sir.
Let's go ahead and play it forward. Stop it.
There.
You see my client walk back into the frame?
Yes, sir.
At this point, you were watching firefighter Flamati. He appears to be now providing CPR, correct?
Yes, yes, sir.
Okay. And my client is nowhere near you, correct? At least for this clip.
No, sir.
Okay.
Correct.
And the clip that I just played before, the few seconds that I played before, nowhere near you, correct?
Correct.
Is that right?
Yes, sir.
Let's go ahead and play it forward.
Where is she when he's giving airway support? That's her in the center of the stage, yeah? Going off to the right now. Bring the stretcher.
Pause it, please. What do you see happening on the screen from screen right to screen left at this juncture?
We're bringing in the stretcher.
Okay, go ahead and play it.
Karen's to the
Pause
right
it.
still.
Do you
Getting
see where my
hugged by
client is
Karen.
right now?
Can you back it up 2 seconds? I'm sorry, I lost
With the
view.
court's permission, I need to ask the
Yes.
court's permission. Thank you. Okay, let's go ahead and play it. Pause. Did you see my client?
Yes, sir.
Where is she in the frame?
Behind that other individual.
Behind the SUV?
I believe she's in
No.
front of the SUV and behind the other individual.
Okay. I meant the SUV, that's the white SUV that's in
Yes, sir.
the far distance.
Yes.
That's the back of the SUV. She's behind it, right?
Correct. Yes.
Okay. Not near you.
No.
Okay. Let's go ahead and play it.
There she is.
Go ahead and pause it. Do you see what firefighter Flamati is? Entire clip.
Chest compressions?
Okay. Let's go ahead and play it. Pause. What's happening now?
Where
She's nowhere near any
Mr.
of
Keith's
them.
on the scoop stretcher and he's being transferred
Yeah.
to the ambulance stretcher.
So that's the
Five
entire
of them.
time Mr. Flamati, firefighter Flamati, was giving chest compressions. It's captured right here on this video, correct?
Yes, sir.
Okay. And now Mr. O'Keefe is up on the stretcher, and you are no longer knelt down,
No, sir.
and firefighter Flamati is no longer knelt down,
No, sir.
and you're now
that's
following the
when
stretcher
you
with, it looks like,
did it.
2 or 3 other EMTs, correct?
I am not in that frame, sir.
Okay, so you've walked away.
Yes, sir.
All right. Let's go ahead and play it forward. Pause it. You see where my client is?
Yes, sir.
Go ahead and play it. Do you see firefighter Flamati or firefighter Kelly continuing to give chest compressions?
Yes, sir.
Which one is that? Do you know?
Believe it's firefighter Flamati.
Flamati?
Believe so.
Okay, so he's still doing all the chest compressions from start to finish.
Yes, sir.
Okay. And what's happening right now?
Now we are transferring to ambulance 1.
And where's my client?
Right
In the center.
front center.
Yep.
May I have just a moment, Your Honor?
Yes.
Do him at all.
If I may have just a second. With regard, just a couple of more questions with the court's permission.
Okay.
I'm going to change gears with regard to what you talked about on direct examination, the hypothermic conditions. You're not a medical doctor, correct?
No, sir.
You don't diagnose patients?
Sir.
You're not diagnosing that John O'Keefe suffered from hypothermia that night?
No, sir.
Thank you. That's all I have.
Okay. Can you follow up?
Please. Firefighter Nuttall, the video the defense just showed you, did you notice any differences between that video and when I showed it to you, and that it doesn't have the time on it?
Yes, those were 2 different time frames on that video.
And when we spoke about when the defendant said to you, I hit him, that wasn't shown to you in that video just now, was it?
No, it was not.
So if we go back Will you be able to explain where you came from and firefighter Flamati came from and when you first went over to John O'Keefe?
Sure.
With the court's permission, Ms. Gilman, if you could start that video. I think it is 6:11, please. Now stop it there. Do you see that this exhibit has timestamp on the top?
Yes, sir.
Okay. Please continue. Could you stop, please? Do you see the red lights on the left?
Yes, sir.
Is that when you believe that you first arrived?
Yes, sir.
And that note says 6:11:05. Could you continue, please, Ms. Gilman? Please watch to the left. Stop, please. Is that when you first arrived and walk over to help John O'Keefe?
Yes, sir. That's me.
I'll note that the timestamp is 6:11:21. Okay, continue, please. Stop, please. Did you see firefighter Flamati come after you?
Yes, sir.
Was any of this shown to you during those questions?
No, sir.
No. Continue, please. Stop, please. Do you see the defendant in that screen?
Yes, sir.
Do you see her moving from right to left towards you?
Sustained as to the form.
Okay. What direction do you see her running in that screen from right to left?
She's running towards where the three of us are grouped.
Okay. Please continue. Stop, please. Is it at that time the defendant said to you that she hit him?
Yes, sir.
And you remember that?
I do.
Okay. I'm done with the tape. Thank you very much. Now, you were asked questions about your memory.
Yes, sir.
Okay. When you were asked the questions about Trooper Proctor, when you were saying that you didn't remember, were you referring to the conversation with Trooper Proctor, or were you suggesting you didn't remember what happened that morning?
I don't remember the interview with Trooper Proctor. I remember it happened. I don't remember the substance of what was discussed entirely. I remember we discussed that morning, but.
Do you know if that conversation was recorded or just a conversation between you and the trooper?
I do not know if it was recorded.
You asked questions. I want to ask you about questions on Mr. O'Keefe, and you mentioned that there was some type of blood clotting on the back of his head.
Yes, sir.
You noticed there were abrasions on his right arm.
Yes, sir.
You noticed there was a hematoma on the right side of his head.
Yes, sir.
Did you see any bruising on his right knee?
Don't recall, sir.
Did it stand out to you that all of his injuries, all of them that you saw other than the cut on the back of the head, that they were all on his right side?
Yes, sir.
Did you notice any hematomas on his left side?
I did not.
Did you notice any scratches or abrasions on his left side?
I did not.
Did you notice any marks that would be consistent with an altercation on the left side of his body?
I did not.
You were asked about the cause, and you said that you don't know the cause. You weren't there, were you?
No, sir.
You asked if it was consistent with being punched, and you said it could be.
Yes, sir.
Could it be consistent with being clipped by a car?
Objection.
Sustained as to the form.
I haven't heard one
You were
word,
asked
if any.
questions about clothing.
Yes, sir.
And you had at one point said you thought that Mr. O'Keefe was wearing a winter jacket. Do you have any memory that when you first got there, or when you first got there, do you have any memory whether there were any towels wrapped around Mr. O'Keefe's head?
I remember there was a white cloth of some sort on the scene.
Okay. And when you were asked about your memory regarding the clothing, was the clothing of what was utmost importance to you at that time?
No, sir.
And why is that?
I was, again, focused on Mr. O'Keefe's airway and ventilation.
Okay. And when you were asked about the clothing, do you remember if you added anything else about your certainty or uncertainty about clothing when you previously gave a statement or testimony?
I believe when I testified last year, I did note I had no part in removing any articles of clothing or anything like that. That was not my job in the back of the truck.
Do you remember any recognition of the fact whether you were certain or not about clothing?
Repeat the question, sir. Sorry.
Well, is there anything that would refresh your memory about what you had said about clothing?
Objection.
Ask a different question first.
You had mentioned that you had some difficulty about clothing. Do you remember what you had previously said?
I remember there was some difficulty of getting the individual's fingers through clothing just because they were so cold. They were difficult to manipulate. Just they really was not conducive to getting clothing off easily.
Okay. You met with me 3 times?
Yes, sir.
I had not met you before any of your prior testimonies, had I?
No, sir.
Do you remember meeting with me and discussing this case with me?
I do.
Do you remember me asking you to tell me what you remember?
I do.
Do you remember what I told you about testimony when you come into court?
Yes, sir.
Or what did I tell you?
I remember we discussed that just tell the truth.
Did I tell you that it doesn't matter if there is no side? It doesn't matter if it helps or hurts, that you just tell the truth?
Sustain.
Did I ever suggest to you that you should stick to a story?
No, sir.
Did I ever suggest to you should offer your testimony in any certain way?
No, sir.
When I talked to you, did I ever ask you to say anything about your testimony to this jury?
No, sir.
Other than what?
Speak to the jury.
Did I need to tell you to tell the truth?
No, sir.
And in telling the truth, did the defendant say to you, I hit him, I hit him?
Objection.
I'll allow it.
Yes, sir. 3 times.
And in fact, do you remember, in addition to her saying, I hit him, I hit him, I hit him, when you asked her the question, kneeling down over John O'Keefe's body, do you remember if you ever talked about other times that she said it, not to you?
I do not.
Okay.
The answer is I do not. Next question.
Okay. Do you remember testifying previously in this case?
Yes, sir.
Okay. Do you remember at all discussing whether or not, after she left you, whether or not the defendant was still talking and speaking?
I'm sorry, sir. Repeat the question.
Do you remember, after the defendant left you and made that statement to you, do you remember talking, did you hear her speak to other people after you?
I heard her having conversations in the background, but that was not my focus at that time.
Okay. And during those conversations in the background, did you hear her talk about that same issue again?
I believe she said it several times, but the 3 times she said it to me were what stuck out to me.
Okay. And when she said it to other people, it wasn't directly to you?
No, sir.
Move to strike.
So watch the form of the question, Mr. Brown.
And when she said it to,
Stating the objection.
when she said it to other people, do you know who she said it to?
I do not.
I'll allow it. So the answer is I do not.
I'm sorry.
Do you remember when she said it other times who she said it to?
No.
I'm going to see counsel at sidebar for this.
No, it was funny. You knob. It was 10 seconds. Yeah, that was for the Hank Brennan is a good lawyer or something like that. And I'm like, take it back. 10 seconds for you. Thou shalt not swear.
Bollocks.
I might have to go and watch this in the boudoir shortly, I think. My back is just about to start.
Well, it has been nearly 6 hours.
Yeah, I know. I've got to take some more pain meds as well. It's sitting in the one spot, it's staying stiff. It just cramps up and then it starts spasming as soon as I can't twist. I went to pick up a pen off the floor and nearly. Yeah.
I'm just impressed my voice is holding up.
Well, you're not really saying a great deal. Ow. See, that's
That's why I'm not saying a great deal.
What was that?
That's why I'm not saying a great deal.
Don't you apologize. I was being funny. The other day, Uda Hef were at it. Uda Hef and I were at it in the chat, going back and forth, back and forth.
Oh, yeah.
Back and forth. Like, it was on like Donkey Kong. And then, what had happened? Something came up about. Oh, no, Uda Hef made a comment about, like, you know, and they just believe everything he says, just like it was Jesus Christ himself. And I'm like, no, I disagree with that. No one has convinced me beyond a reasonable doubt or beyond a degree of scientific certainty that he's ever existed.
We did.
And at no point at that time or after did my client even approach you, did she, in that clip?
She did.
What?
Oh, that's look at that body language.
Just a question.
Sure.
Yeah, eyebrows raised. Yeah. Come on, that's like.
Do you need to see the that clip again?
Yes, please.
We're not going to show a video again. We've seen 2 videos. Which one is marked?
The
The
Commonwealth.
one with the timestamp
Right.
at the top?
It's the exact same video. One has timestamp, one doesn't. Just to be clear, you described a very detailed scene in which firefighter Flamati got down on the ground on his knees and began CPR.
Yes, sir.
You'll know, trust me.
We saw a clip that was
I can't hide it very
played
well.
fully through. Starts and stops, but it played fully through. Correct?
Yes, sir.
That was true and accurate video
Safe word.
of what happened that day,
Yes, sir.
that morning. Correct?
Correct.
And from the time firefighter Flamati began his CPR, he never stopped. Went all the way through until the burn was taken off the camera. Correct?
Correct.
You also described very clearly before you saw the video that the time when my client walked over and you had this dialogue and you heard this statement, it was during the time that firefighter Flamati is given the CPR. Correct? You described it.
Yes, sir.
But when we actually see firefighter Flamati giving the CPR, as per your description, at no time did my client walk over and have a conversation with you, did she?
She did in the video.
In the portion that Mr. Brennan played you, was firefighter Flamati giving CPR at that point?
As I said previously
Was
as well.
he or was he not? Yes or no?
Objection.
I'm going to let the witness answer the question.
Firefighters Kelly and Flamati were trading off CPR. Tony
Really?
started doing CPR, and it
No.
was passed off at one point to Firefighter Kelly.
He was
Firefighter
doing-
Kelly at that time was a BLS EMT. Firefighter Flamati was a paramedic. They're going to move towards Firefighter Kelly performing CPR because at that time his skill set was not as advanced as Firefighter Flamati's, as Tony's.
It's got to
But they did switch off.
Kelly.
That is a routine cardiac arrest. We switch off compression.
But the video that Mr. Brennan showed you was earlier in time, a few seconds or a minute or two earlier.
Yes, sir.
You'd agree with that, correct?
I would.
And firefighter Flamati had not begun CPR, had he?
I don't believe so.
That's right. He hadn't. But that's the time that my client walked over your general area, correct?
Correct.
Before CPR was started, correct?
CPR was started immediately, sir.
Can we wrap this up?
I don't know if you can, Judge.
Give you a couple more minutes.
Do you understand the confusion?
Objection.
Sustained.
All right, a couple more questions on this. The video that Mr. Brennan showed you,
Yes, sir.
and you pointed to and said, oh, that's the time when she walked over and said the statement.
Yes, sir.
Remember that?
I do.
Firefighter Flamati was not even kneeling down giving CPR, was he at that point?
No,
The answer is yes or no?
No.
Okay, he was not. Later, as the video continues to run, at some point, we see Firefighter Flamati enter the screen, kneel down in that bright, reflective yellow jacket, and begin CPR, correct?
Yes, sir.
You had previously said that when you heard the statement and she walked over to you, it was when Firefighter Flamati was giving CPR, correct?
Yes, sir.
It's not
And
easy.
At no point, you'll agree with me, we just played the video. At no point after he started giving CPR did my client come anywhere near you. Isn't that what the video showed?
That was the segment that you showed me.
You indicated on redirect that Mr. O'Keefe did not have any injuries to the left side of his body.
Not that I recall.
Isn't it true that in addition to the egg on the right side of his head, he also had a black eye on the left side?
I remember that the swelling had started to, it's referred to kind of as raccoon eyes. It's a bruising of both eyes.
look.
Do you
Or
remember
battle
saying-
signs.
Someone clever
Do you
said
remember
that
saying-
earlier.
In answer to the question, did it look like, in addition to the egg on the right side of his head in the front, did he also have a black eye on the left side? Your answer is, if memory serves correct, yes.
Yes, sir.
So it's not true that he didn't have any injuries on the left side of his body or face, correct?
That swelling kind of migrates over time to both sides. That is a common occurrence for both eyes to be swollen.
Did he have an injury to the left side of his face?
He did not.
Did he have a black
Fuck
left
off.
eye?
Yes,
Fuck
he did.
off. The
Would you
pressure
consider a
in the
black
skull
eye
is the
an
same.
injury?
Yes, sir.
Let me ask you the question again then. Did he have an injury to the left side of his face?
Yes, sir.
Thank you.
Doesn't just go, eeny, meeny, miny, mo, I'm going to go out the right side right now. I think the reason they've hammered him so hard is because his testimony has changed from the grand
One last
jury.
question. You
Proctor's
indicated
to his
that it
testimony
was a chaotic
today.
scene outside on that front yard.
Yes, sir.
Fire engines, ambulances, patrol vehicles, engines running, diesel engines, flashing lights, people screaming, people talking over the howling wind, correct?
Yes, sir.
Did you ever see the homeowner come out the front door?
Don't recall.
You don't recall, or you didn't?
I have no idea who the homeowner is.
And you never saw anybody come out of front of the house?
No, sir.
I wonder if they'll bring that up, that Article
One issue.
14, because they've
Briefly.
mentioned it a few times now.
I want to see.
They didn't.
The last question at least made sense.
What? Did you see him come
Whether
out?
whether he saw anyone come out the house.
Mm.
That at least made sense. A lot of the other stuff, to be honest, they were just barking up a tree for the sake of making noise.
No, they're trying to get, like, I can see where they're going because I can see what he said. Pretty much, like,
Yeah, but
I can see where they're going, but because he's changed it 3 times, that's what they're trying to. They're putting the emphasis on the wrong syllables.
yeah, but the difference is you have your database and can see this. The jury don't.
No, but the defense fucking does.
Yeah, but they're not telling the jury this.
They're trying to get it out, but he's evading every one of them. He's like going, because what he's saying is he specifically heard her say it when this particular paramedic was giving CPR on his knees, and he was then doing the bagging at the same time. Yet Alan Jackson showing that video showed that the entire time, because it showed when Flamarty started CPR until they took him up on the stretcher, the entire time. And not any of that time did Karen come near him. So when Hank showed the other video, it was a different time frame. Yes, she may have come near him, but it was different. So there's multiple different things that he has said in his 3 different statements that don't align. Does that make sense?
It does, but the problem is all the jury is going to do is go, okay, so he was confused about who was stood next to him, not he was confused about what he heard.
But at the end of the day,
it doesn't do the defense any good that the jury just thinks, okay, he heard it at a different point.
They're just going to think he's not as credible. That's their aim.
But they're not getting that across because the defense, by only showing part of that video, damaged their own credibility when the prosecution was able to go, well, yeah, but here's the full video with the timestamps on.
Yeah, but then Alan Jackson went back and showed it again and explained why. Did you see that?
No, the judge said he couldn't show it again.
Question for Jody and Dan. Is the defense saying the paramedic misremembered what happened or what? I don't know. They're just saying that it is inconsistent to his prior statements. So the first time, because this even brings in Flametti, I asked it one question and then it came up and said, extracting from Nuttall's interactions with Katie Milne, extracting instructions, testimony and interactions with Flametti and Kelly. It tells me who was on the scene, what engines, like not just the ambulance, separates ambulance, engines, command vehicle, and then the verbal communications between each at the scene, because I asked it specifically for the scene, the ambulance, and the hospital. But yeah, the first time he said that Karen said it, he said she said it once, and he said she said it to a woman, another woman, not to him. The second time he said it, he said she said it twice directly to him whilst he was giving airways and this CPR was going on. And now he's saying she said it 3 times. So I don't know.
See,
I don't know.
All of that's great, except the jury doesn't have access to all of that or any of that.
Mm-hmm.
The defense,
they need to get that across.
The defense are screwing it up, and they're just basically trying to shotgun this. Fire a shotgun burst, whatever sticks.
Well,
They're not saying, they're not being specific about whether the guy's lying or misremembering. They're just trying anything they can get through. And that's how it comes across. It's not a good line. They're not doing it in the right way. Whether you think he's innocent or guilty is irrelevant. It's the defense are really bad at this. And after last time and how really they made a screw up of so many things, you'd have think they'd have learned to narrow their questions a bit and be more focused rather than just trying to shotgun blast everything.
Yeah. No, I don't think that at all, Udahef. I just think that the defense are doing their job in this one and trying to poke holes. That's all. That's their job. Simple. I don't think at all that he's thinks that he's lying or misinterpreting or misrepresenting. I mean, things happen so fast in those. But generally, see, I didn't work on scene. I worked in the hospital. So you had a scribe, someone who actually kept a record of every minute, you know, what medications were given, because you have to. But in a scenario like that, you've only got the dash cam now, but you never used to even have that. So your memory, he made the mistake of saying that his memory improved over time, being a smart ass.
Yeah. That was a stupid thing for him to say. Yeah. He's not a good witness, but the defense are screwing up, tearing him apart.
Yeah. And then he got defiant.
Yeah. And this whole business, they're now going to go on about it being a chaotic scene. Well, no shit, of course it is. Every single scene they turn up to is a chaotic scene. Otherwise, they wouldn't be there.
It wasn't on the ground long, like once they got there. That wasn't long before they had him on the stretcher and in the ambulance. That was pretty quick.
Yeah.
Counsel at sidebar.
Sidebar, what? Ow, fuck. Sidebar swipe. Come on, where are you? There. Yes, we remember you, John. That says 2:54 p.m. Eastern time, doesn't it? Oh, hopefully she cuts it early after this fucker.
She might. They're already going over 6 hours.
Mm.
And she does seem to be losing patience with all of them at the moment.
Mm-hmm.
Sir, in Mr. Jackson's questions, he asked if you had ever said that you heard the defendant say, "I hit him," separate from when she approached you. Do you remember previously testifying that you heard her saying, "I hit him in the background," separately from you?
Yes, sir.
You remember testifying that before under oath?
Yes, sir.
In court?
I do.
Anything, Mr. Jackson?
Yeah, just a second, right.
Well, they have to hammer him because he's the only one that's saying, and that he heard those 3 words now. After Jen McCabe
Thank you, if I may.
Yes.
Just a quick question, Firefighter Nuttall. When you were asked to recite your memory of that day on February 8th, 2022, just 10 days after this incident, did you ever say that you heard in the background, "I hit him" over and over again?
I don't recall.
All right.
When you testified at the grand jury, last question, when you testified at the grand jury, did you ever say that?
I don't recall.
But again, your memory is better now than it was then.
Ah,
Yes, sir.
All right. Firefighter Nuttall, you are all set.
Thank you, ma'am.
All right, your next witness, Mr. Brennan?
Thank you. The call
damn it.
calls Kerry Roberts.
who? Terry Loggins.
Roberts.
Ah, okay.
Chrissy, could I get anything?
Terry Loggins.
Screw you, Turtle Boy.
In the stand, I did have an exhibit I would like to introduce and
Okay.
play for the jury.
Okay.
And this is clip 2.
No objection from the defense?
No, Your Honor.
And you're marking this as an exhibit?
Yes, Your Honor.
Okay.
Right hand.
Do you have something for the court reporter to mark?
We can put it on a zip drive. We can discuss collecting all the clips and putting them on the same zip drive, or we can use different zip drives.